Good morning, everyone. I'd like to call this meeting to order. A warm welcome to everyone. Tuesday, February the 9th at 9 o'clock or shortly after. First order is adoption of the minutes. I'll entertain a motion to approve them. Unless there's errors.
So moved, Mr. Warden.
Moved by Mennel, second by Purcell. Thank you. Please call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden.
Yes,
9-0, the motion is carried.
thank you for that. I would ask if there's any disclosure of pecuniary interest, general nature thereof. I'm not seeing any, so we'll move on. Our next is presenting petitions. We have a delegation, Elgin, Ontario Health Team. I would like to welcome members of St. Thomas Council who are joining us. On the way in this morning, I was reminiscing, one of our last meetings, a lot of us in this here now attended down at the library. I believe it was on affordable housing. And that is just before all this stuff, because I remember we had to call and started to send some of our ladies very close to having a baby, and they went home. And in fact, I remember one of them was actually come back from a year. So it's amazing. It's been a year already. So it's hit us some days. I think we're all suffering a bit of fatigue. I've noticed that some of our constituents are a little grumpy at times. I think we're grumpy at times, but it's nice when the sun comes out and we get a good night's sleep and we do our best. But it's been stressful, and there's been so many good people step up, done remarkable things, and we're still here. So we look forward. I can't wait to start complaining about cutting grass. So it's coming. It's amazing how you're, close to halfway through February already. But enough of me. Elgin Ontario Health Team, you have the floor. Welcome and go ahead.
Good morning, everyone. My name is Daniel Doan. I'm a consultant who's been supporting the Ontario Health Team development with Elgin County partners. Today, what I'd like to be able to do is just give you a little bit of an update on the OHTs themselves, the process that Elgin partners have recently been going through, and a little bit about some of the next steps that you might expect in terms of the development of the Elgin OHT. I see that Robert Byron here is from the hospital is here as well. So Robert, if there's anything during my discussion you'd like to intervene in, please feel free to do so. Okay, the next slide, please. So I think, again, I'd like to talk a little bit about the overall model, how we actually have been working over the last year in terms of the development of an application to become an OHT, what that vision of the Elgin OHT partners is, so what the vision for an Ontario Health Team in Elgin will look like, and then talk a little bit about next steps. So you're probably have heard by now, certainly I'm sure you're very familiar with that the province of Ontario is undergoing a fairly significant restructuring to the health system. That involves a number of things. I think most importantly and most significantly, the creation of a new centralized agency that really starts to blend a number of the other agencies, provincial agencies, including the local health integration networks, into a large single organization called Ontario Health. The other really significant change has been the establishment or the development of what we're calling Ontario Health Teams. And that's really a new approach to organizing the delivery and management of local healthcare. It really provides an opportunity for local healthcare partners to work together in a way that they haven't done before. The structure removes some of the barriers, some of the fiscal barriers and the organizational barriers that have sort of stood in the way of health organizations working more collaboratively. And it really is intended to be a model that provides an integrated approach to local healthcare delivery and the local healthcare experience. So there's a number of goals, and one of those certainly is in the improved experience, improved outcomes for patients within local communities as well. The other thing that Ontario Health Teams will do is really establish a single point of both clinical and fiscal accountability for a local health system. so that the partners together will own that clinical or the outcomes for their patient populations, as well as for individual patients, as well as how funds are used in the local system. It gives them both more control, but also a shared accountability among partners for performance. Next slide, please. So the process began back in February, or was announced back in February 2019, and there's several stages that a group of partners have to go through in order to become an Ontario Health Team. The first phase was a self-assessment, which organizations basically took an inventory of their current partnerships, the way they work together, and that was submitted to the ministry. And then the second phase, once they've been validated, was an invite to apply a full application. And it's a very complicated, fairly in-depth process about providing information on the partners and the vision, capacities, those kinds of things. And it really requires the work of the partners together. That work began last year for Elgin, the Elgin partners. And they worked together over the last year. It was a bit of a pause because of COVID, coming back in the late summer, early fall, and submitted their application in December. And actually had a recent virtual visit, which I'll mention a little bit later on, which is the next stage in the process. Once they become approved, they become a candidate and they can begin implementation of the OHT model and begin to work as an OHT. There's some funding opportunity I'll talk a little bit about as well that can support the work over the next little while. And then at a point where the OHT reaches what they call maturity, which there are a number of criteria that an OHT will need to demonstrate, the province will designate them as a full OHT. And at that point, a few things happen that are a little bit different, but the most significant is that there is a single funding envelope for the partners, and we begin to work in a more integrated fashion in terms of that funding model as well. Those timelines and what that will look like are still not very clear. None of the OHTs are certainly at that stage at this point in time, and OHTs, I think, are anxious to learn what that integrated funding structure will look like. But they certainly are working toward that integrated fiscal and clinical accountability for the next several years. Next slide, please. So in Elgin, they've been actually working for quite a while, really, and have a very strong partnership. There are 24 different partners from across different subsectors of both this health and social services sectors, as well as having 3 patient partners. So patient engagement and patient participation is one of the strong features of Ontario Health Teams. Certainly won't go through the full list here, but you can see that Elgin really enjoys really broad support and broad participation. Not the case in all OHTs across the province. So I think it's something that the partners and the community can be very proud of. Next slide, please. So the group of partners have been working together as a steering committee and have been working over the last several months to develop the application, which was the next stage in the OHT process. As part of that, they've done considerable stakeholder engagement. You can see here just some of over the last several months in 2020, the kinds of engagement processes that were provided. Engagement, again, is a strong feature of Ontario Health Teams, and they expect that kind of engagement to continue into the future. Very much focused certainly on patients, families, and caregivers, but also a range of other community stakeholders. In terms of the vision that the Elgin partners have developed, I think what's really important here, you can see on one side, we have the OHT ecosystem. This is really about connecting and bringing together a wide range of both health services, but also what we might call enabling or services that support other social determinants of health, like housing and social services, and really beginning to work together as a single integrated ecosystem. In the middle of your diagram, you'll see patient-centered health and wellness. So OHTs have a population health-based approach as well as an individual health approach. So being able to really focus on the health of the community and the populations, subpopulations within that community is one of the key areas. And bringing together in a set of wraparound services, really all those possible services, both health and social services that are required to keep people and communities healthy. And the OHC really becomes the platform for that, if you will, for being able to make sure that the access to those services is seamless, that the transitions between those services is seamless, and that the providers in those services are really working as one single team. I think it's really reflective in the name of the Ontario Health Teams as well. We have goals that are really reflective of something we call the quadruple aim, which is really improving experience for patients, families, and caregivers. Really having a population health, really focusing on a healthy community, improving the experience for providers themselves, and really ultimately improving quality and being more fiscally accountable and more fiscally efficient with our healthcare dollars. Next slide. In the first year, all the OHTs were asked in their application to focus on a priority population as sort of a pilot in order to begin to develop capacity and scale in the future. Looking at the data, the Elgin OHT partners have decided on to tackle a population with respiratory issues, particularly for those patients who are 65 and older. That largely represents population who have a diagnosis with COPD or at risk for COPD. So that will be the focus in year one. It provides an opportunity to work more collaboratively, provides an opportunity to build on initiatives that are already existing within the community. There's a number of very strong COPD and respiratory related programs that are happening both in primary care and in the hospital environment. So it provides an opportunity to leverage those as models that can be extended and learned from, and eventually serving the full population, which for Elgin is around 70,000 people, what the province calls our attributed population. Next slide, please. In the first year, one of the, or actually very quickly, one of the first requirements will be to develop what's called a collaborative decision-making arrangement. That's really how the partners will organize themselves to make decisions in the first year, and then eventually to transition that to a sort of a more permanent governance structure. I won't go through it in detail at this point. It's an emerging, I think, structure at this point, but it will be an important point because once, in order to kind of receive the next round of funding, the partners will need to sign on to and attest that they have a collaborative decision-making arrangement in place. So it's going to be an important component in order for them to move to the next step. But again, I think there are a number of strong models in the province to build upon, and the partners have already developed some straw dog models that will continue to be the focus and refinement over the next several months. Next slide, please. So as I mentioned, once the partners have signed on to the CDMA or have attested that they have a collaborative decision-making arrangement in place, there is funding available for fiscal 2021-22. About $750,000 that can be used by the OH2 to do a number of different implementation activities, such as digital health. So digital health, investing in that, investing in clinician leadership, patient engagement, project leadership and management, and strengthening performance management and quality improvement. So there are some startup funds that will help the partnership and the OHT really accelerate their implementation, particularly in the first year. Next slide, please. So as I mentioned, that the next stage has already happened. So the submission actually went in about mid-December. And in January, there was a virtual. These visits, of course, used to be in person, but now they're virtually with the ministry, with the partners. They talked a lot about things like collaboration, engagement with primary care, hospitals and home and community care, engagement with patients in the community, and the focus of year one. So that, I think, was a very positive development. That's certainly the next step. And I don't think at this point in time, though HT partners have heard about what's happening next, but I think that decision will probably come fairly soon from the ministry and will allow the OHT partners to begin to move to the next stage of the process. Next slide, please. So again, I think the next stages really is that receiving that designation from the province. So we're not quite sure when that will happen as a candidate. Then finalizing those collaborative development, those collaborative decision-making arrangements, which is work already, that's actually already in progress. And once that's been done, by April 1st, that year one funding kicks in and allows the OHT to really accelerate their implementation and the work that they're doing moving forward. So that's all I wanted to share with you, just to give you a bit of a flavor of where, what that process looks like and where it's at. I can certainly answer any questions you might have as well. Or Robert, I don't know if you have any additional comments.
Well, thank you, Daniel. I appreciate the report. I will invite anyone with questions to please go ahead and ask. I'm not hearing any. Don't be shy. Do we have someone on the phone?
Peters is on the phone.
Go ahead, Steve. Welcome.
Oh, no, sorry, I don't have a question. I thought you were just wanting to know who was here.
Oh.
Sorry, Mr. Warden.
No problem. Doesn't look like any questions. You did a good job, Daniel.
Great. Well, thank you very much. I appreciate the opportunity to share with you, and have a good day.
All right, thank you very much. We will move on to our second delegation.
Just receive them.
Yes, a suggestion that we receive. Mover and seconder, please.
I'll move, Sally.
Thank you. And a seconder, please.
Jones.
Okay, Martin and Jones, please call the vote.
Deputy Warden Mennel,
Yes.
Counselor McPhail,
Yes.
Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden.
Yes,
9-0, the motion is carried.
thank you. Our next delegation, we've got Robert Biron from our local hospital. Good morning and welcome. I think you're going to give us, talk to us about magnetic resonance imaging, MRI. I've certainly had my share of them, so, and I know there is a need for them here. I remember going to Stratford in a bad snowstorm to get one. But please, you have the floor. Go ahead.
Well, good morning, Council, and thank you for the opportunity to present to you this morning. And I think your comment resonates, no pun intended, with many members of our community, and hence the importance of elevating this opportunity to the provincial level as they prepare their provincial budget. I do want to take a moment. The last time I presented to you was pre-COVID, and part of the update I had provided was also a call for your support to solicit the province in terms of addressing the inequities in terms of funding for medium-sized hospitals. And I know both the city of St. Thomas and as well as the Elgin County did take that to heart and supported the cause. And through the efforts of the 20-odd hospitals and their respective municipalities, we were quite successful in having some funding adjustments that closed the gap in terms of our issues. So your contribution and your voice matters, and it certainly had an impact. So wanted to extend our appreciation for that effort. Today, I'm before you to talk about the opportunity of introducing magnetic resonance imaging, or MRI service, to the Elgin community. And from my perspective, it's a service that should have been introduced long ago. 10, 15 years ago, and it is a tool that is really at the core and basic medical technology that should be introduced in this community, and it's long overdue. So we have an opportunity to elevate this as the province goes through their consultations for the 21-22 provincial budget, and that's what I'm going to cover with you today. The next slide, please. So just a brief for those who may not be familiar with the MRI technology. It is a core technology that most departments of diagnostic imaging would have available to them. It's one of many important tools to be able to diagnose and treat and follow up patients depending on their disease. This particular technology, the unique thing about it is that it's through the use of magnetic fields, and so it doesn't emit any radiation, and but it is specifically for certain types of imaging, particularly for organs, the brain, as well as soft tissues, and so it has very specific applications, and so. It's as I said, it's an important piece of the tool set that our radiologists would have available to them. Next slide, please. So in terms of looking at the scope of services that our hospital currently provides, the MRI would certainly round out and support our existing programs. We have, we were designated a stroke center in 2016, and an MRI is essential for treating stroke patients. Unfortunately, today our stroke patients are transferred to Woodstock Hospital for their MRI images. That's not good quality care. It should be on site here so that they have immediate access to the service. We also would be in a position to use the scanner for diagnosis and management of certain ailments and disease, so orthopedic conditions, as well as many colorectal and breast cancer cases. We also have one of the busiest emergency departments. In fact, on some quarters, when you look at our actual volume, we're the second busiest emergency department, ahead of University Health on some months in terms of volume. And so, there's an opportunity there to support our emergency department having this service available. Next slide, please. So when we look at the community that we serve, there's a strong case for to position the MRI. And as I mentioned in my opening remarks, it's something that we had a strong case for 5-10 years ago. And the fact that it's not here is a bit of a head scratcher for me. And it really is an inequity for this community. We know that there's about 5,000 MRI scans every year of residents that live in Elgin. And so you think about the commute time, and the vast majority of those do go to London Health Sciences, but there are some that actually travel to Chatham-Kent, to Woodstock, to Stratford, and even further when they're looking for the shortest wait times for getting a scan. Again, that's not equitable access to care for sure. We also know that we are serving one of the older populations in the Southwest. In fact, we expect that population to grow immensely over the next 2 decades. And we're one of the few hospitals, medium-sized hospitals, not to have the service, and we're one of the few counties not to have the immediate access to the service. And so, we're trying to do is position this matter that is an issue of equitable access to what is really a vital service that should be available to a hospital in a community of this size. Next slide, please. When you look at the wait times across the province, they're actually quite extraordinarily long. But to look at our immediate referral center, which is London Health Science, they have a number of machines that are available, but their wait times are incredibly long. So this slide, I just pulled the data, and you can pull this directly yourself from the Ministry of Health website. It's available publicly. The most recent available data is for November 2020, and you can see that only about 2/3 of the patients were scanned beyond the provincial target time. And then if you look at some of the lower priority scans, so level or priority 3 and 4, but 4, for example, you're waiting 169 days when the provincial target is 28 days. Only 7% of the patients actually got scanned within the targeted time. Again, it's not an acceptable wait time for our residents and our patients that desperately need the imaging in order so that they can get the diagnosis and the treatment that they need. And what's more is that with the pandemic, we've seen our diagnostic capacity, not just with MRI, but pretty much most of our modalities, is that the capacity has been reduced by about 20%, and that's simply because of the infection control protocols that we have to adhere to ensure that the room is cleaned and safe for the next patient. And so the turnaround time of the rooms is not as quick as it used to be. And so we're going to expect wait times to continue to further be extended. And we also have long wait times prior to COVID now are becoming even more so. Next slide, please. So in terms of our specific application, the good news is that in February of 2019, we did get approval from the Board of Directors of what was then the Ministry Agency of the Southwest Local Health Integration Network, or LHIN. So that was certainly a key milestone. And so they supported it and submitted it subsequently to the Ministry of Health in March of 2019. And we subsequently reached out to the ministry, and unfortunately, in that fiscal year, the ministry had not had a budget allocation for new MRI capacity across the province. And then we were moving ahead a year, March 2020, we were about to ramp up our advocacy as we are today to secure the province in terms of having an allocation for this in their provincial budget. But as you know, in March of at this time last year, that's when the pandemic broke out, and obviously our attention was diverted elsewhere. And so we had the opportunity today to plead our case with the province through the budget consultations that are currently underway. I presented to, there was an opportunity last week to do that, and I presented to the Minister of Finance there. It was through the London invitation, and so that's been done. And as well, we've sent a correspondence to the Minister of Health. I can copy the Minister of Finance as well as our local MPP Jeff Urich. So we're doing our part. I also presented this material to the City of St. Thomas Council yesterday, and now before you this morning. We were in terms of the actual funding that's required. There's really two elements. There's actually upfront capital costs of about $5 million for the capital renovations that are needed, facility renovations, and then and that would be shared by the ministry, 90% by the ministry and 10% by the local share. But the big ask is the annual operating costs that would be funded by the ministry of about $900,000, and that affords you about 2,000 hours of scans, 2,000 hours of the machine, I should say, and then there's the actual cost of the machine of about $2.5 million. So our share of those costs would be fundraised through our foundation, and we feel that it's an item we have already started to receive some donations on that front, but it's one that we believe we can fundraise for relatively easily. So next slide, please. And then, so I've talked about where we are with the provincial budget process for this year, and really what I'm here for this morning is really for your consideration, is to welcome any support that you can provide in terms of our advocacy around securing this investment for our community and our hospital. And I think with that, I think I've covered the material I wanted to, and turn it back to the warden.
Thank you for the presentation, Robert. Certainly, I get full support that there is a need for it and expectation for it here in Elgin, but I'd invite questions from the council. Comments. Again, it's very quiet. The coffee hasn't hit us yet, but I'm not seeing any. Robert? Sally, go ahead.
I was trying to undo it. Yeah, this is something the hospital board have been working on and very concerned with for quite a long time. They had several presentations on it, and I think it's very important that we as a county offer support. If we can offer vital support or whatever we do, I think this is very important for our local hospital. As you yourself have said, you understand the concerns, and it really does. It's so much more with diagnoses than the other types of scans that we have. So yeah, I think it's really important that we support this.
Thank you, Councillor Martin. Again, I've had them done at Stratford, Chatham, Kent, so yes. And when you need one of them, you're probably living in some pain, so it is difficult. But I do believe our CEO has Councillor McPhail, go ahead.
Yes, thank you, Mr. Warden. Through you, certainly having recently had a scan in London, I found the hardest part of the thing is that your appointment date is so far into the very difficult to remember that you even got an appointment. So certainly I think that the need is certainly demonstrated that Elgin could use a suite that looks after the people in Elgin, and certainly I congratulate the hospital in taking on this initiative and moving down this road. I think it's timely and probably has been stated should have happened many years ago. So certainly from a personal perspective, I support this initiative.
Councillor McPhail, I thought you were going to say the hardest part was laying there and your nose is itching and you can't move. But I believe we have a resolution.
I was a little concerned about the size of the hole. So maybe when you're ordering one up, get one with a really, really big hole.
I think we have a resolution prepared. Please read it, Julie.
Thanks. Be it resolved that the presentation from the St. Thomas Elgin General Hospital be received and filed, and that the warden be directed to send a letter of support to the Ministry of Health and the Ministry of Finance advocating for provincial operating and capital funding to make magnetic resonance imaging service a reality for our Elgin community.
Thank you. Look for a mover and seconder for that, please.
So moved, Mr. Warden.
Mennel and McPhail. Please call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin. Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Jiguer.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Okay, thank you for that, and I'd be happy to sign that letter. Thank you, Robert. Have a
Thank
good
you.
day.
Yeah, thank you, and as well as to all of you. Thank you very much. Bye now.
Take care. All right. St. Thomas Elgin Social Services.
Mr. Warden.
Yes, go ahead.
Mr. Warden, it's just Sally Martin. I just wondered if we could make a copy was our key of that letter. Thank you.
Certainly.
Yes. Yes, thank you. Delegation from the St. Thomas Elgin Social Services. If you're ready, go ahead.
Hello. I'm not sure if you can see me. I don't see my picture up there, but
We can hear, is that Heather?
yeah, it's Heather.
Welcome, we can hear you.
Okay, good. Let me just try to start my video here. Okay, there we go. Good morning, Mr. Warden and members of council. It is a pleasure to join you this morning to share with you some of the great work that social services is doing in the county. My name is Heather Sheridan, and I'm the Director of Social Services. I've worked in the department for over 20 years in many different roles, moving into the director position after Elizabeth Sebastian retired at the end of 2019. So I have brought with me today 3 of my colleagues to give you a high-level overview of social services in the county. Teresa Solowski will be talking about children's services, Joanne Weaver about Ontario Works, Danielle Nielsen about housing and homelessness. It might be interesting for you to know that 3 out of 4 of us make our home here in Elgin County. We are hoping that you leave today knowing that the most vulnerable in our community, all of our communities, including those living in poverty and experiencing homelessness, are a high priority, and that we are doing what we can to support and be a part of the solution. At the end of the presentation, there's a slide with my contact information. Please don't ever hesitate to reach out and contact me if you have any questions or concerns. Teresa's going to start us off from Children's Services, and I'm hoping after each portion we can have a moment if you have any questions. So please, Teresa, start us off.
Good morning, Your Worship and council members. Thank you so much for allowing me to provide you with an update from what's been happening in Children's Services. May I have the next slide, please? So this first slide just gives you an overview of the spaces that we have in Elgin County right now with regard to licensed childcare. You can see that we have currently 734 spaces, with the majority being in school age and kindergarten. And at the top of the slide, you can see that approximately 32 spaces of all the childcare spaces in St. Thomas and Elgin are dedicated in the county. Next slide, please. One of the things that we provide for families is subsidy. So that's financial support for families that might not be able to afford childcare. And you can see from this slide that we continue to offer subsidy to many families in St. Thomas and Elgin. You can see that in 2020 that the numbers are slightly lower, and that truly is because of COVID. A majority of my slides here will be showing the impact of COVID on numbers and services for children in childcare. But I'm confident that now that childcare is back up and running and schools are back, that we will continue to be providing subsidy for families. I do want to highlight that at this time, we are providing subsidy for every family who applies and who qualifies. We continue to not have a waiting list and are able to support families who need that financial support. Next slide, please. This slide is an overview of the childcare waitlist. Again, we were able to divide this out so you can see exactly what the waiting list looks like in Elgin. Yes, we do have waiting lists for children that are in need of care, but I do want to highlight that many families put their child on a waiting list and don't need care right in this exact moment. Especially with infant care, many families will put their children on a waiting list as soon as the parents find out that they are expecting. So this is not a real time. There are not, yes, we do have some children waiting, but we definitely do have a lot of families that are on the list that are looking for care in the future. Next slide, please. This slide highlights a little bit as to what has happened during the period of COVID in childcare. So just to give you an idea, in March of 2020, all childcares were closed when we went into a state of emergency. And shortly thereafter, the Ontario government allowed licensed childcares who could open to reopen to offer emergency childcare. We were able to offer emergency childcare in two centers, the Early Learning Center Dalewood and the YWCA program at Mitchell Hepburn. During that period of emergency childcare, we were not able to find a provider to offer care in the county, but we were able to provide anyone who lived in the county access to the care in town. And during that time, we had about 23 children that access emergency childcare. Once childcare was able to reopen again, that was in June of 2020. Emergency childcare ended for that period, and all our childcare is reopened. We are pleased that every single childcare reopened. We've heard throughout the province that many childcares were not able to reopen, but every single one of our childcares were able to reopen and provide service for families. And school age care resumed in September of 2020 as well. Next slide, please. This slide shows a little bit of information with regard to licensed home childcare. And you can see that our numbers steadily rose until 2019. And again, we took a little bit of a dip in 2020. If I can get you to switch to the next slide. There's a little bit more information here as to where the licensed home child cares are and where we are right now. Again, we now are down to 21 home child care providers, and this is mainly, again, due to COVID and some families. There's some providers that were not comfortable resuming care because of their situations. We are working really, really hard to get this number up again and to really work on getting more providers within the county. Recently, we went into partnership with WeWatch, which is another home child care provider who we are working with to provide care again in the county with another provider. So we are looking to raise those numbers slowly, and Elgin Child Care continues to also work to increase those numbers as well. Next slide, please. I wanted to speak to you a little bit about our early on and child and family centers. Again, these family centers were affected by COVID as well, and I'll talk about that a little bit in a moment. But I wanted to share the information about a transition that we are working on in 2021. In the past, we had one provider that was offering the service across the whole county. And in December, we decided to try a different approach and are going with 3 zones. Each zone will be dedicated to that specific zone. This new system is really put in place to enhance the responsiveness and targeted services across the distinct zones. You can see that in the West, Tiny Tots Cooperative Day Nursery will be offering the program. In the Central, the YMCA will be offering the programs. And in the East, Community Living Elgin will continue to offer programs. And we will be working more collaboratively with the CMSM, our team here, to bring a consistent type of service across the entire zone, but also focusing on the needs of each zone. Next slide, please. You can see here just a little bit of an outline as to what type of services were offered in 2019. We did not provide figures for 2020 because really since March, the programs have been in a different format, and I'll show you what those look like in a moment. But you can see that there are lots of families and lots of children that are accessing the Early On Family Center programs, and it has been very, very successful in our community. Next slide, please. So as I mentioned, with COVID, our in-person centers really have been closed since March 17th, and they resumed again in July, but then again in December when we went into the next state of emergency, they've stopped doing in-person programming. But one of the things that our Early On programs have worked really hard to do was to offer virtual programming. And contact-free services as well. So one of the things you can see, Facebook, they've been reaching out to families with Facebook, sharing information, engaging families in activities to do with their children when they can't come into the center physically. One of the other programs that they had was the Community Bin Program. Materials were made available. They were like packages that were created and they were made available in the following areas: St. Thomas, Dutton, Rodney, Elmer, West Lauren, and Straffordville. And that program has been really great. So families could go to one of these community bin, pick up a package, and engage in an activity with their child or children. The other thing that we've been working on as well too with them is doing Zoom calls where especially groups like new moms that wanted to connect with some more resources, they could have those private phone calls or those private Zoom calls or in small groups with other moms to connect and engage in virtual programming. And this has really worked well. We continue to do this as we move forward because we know that right now the ministry has indicated that Early On centers are not to resume face-to-face programming until a later date. So we will continue to work on that. Next slide, please. Special needs resourcing also, you can see, has been affected by COVID. Special needs resourcing is put in place to support families with children with special needs in childcare so that they can attend childcare in an integrated model. And this takes the form of resource consultants who work directly with families and childcare providers, as well as providing support staff that may be put in place to work alongside a child or a group of children. As you can see here, our numbers definitely did take a dip with regard to program assistant hours and engaging with children, because many children did stay home during the shutdown and during the lockdown. Next slide, please. These are the numbers that are specific to Elgin County with regards to resource consultant visits and assistant hours. And again, you can see the numbers between 2019 and 2020. We have been working very closely with our special needs providers to ensure that no family is left alone or left without any services. So again, they have been providing services in a virtual format, connecting with families, doing Zooms, going into the childcare programs when able. But they have been working really, really hard to make sure that all families are supported. And my next slide, please. And I wanted to leave you with some information about some of the projects that we have coming up in the future. We do have a project in Rodney, which is the Alderborough Public School. There will be a child care with 49 spaces, infant to preschool, and 15 nursery school spaces. We're happy to say that this has been approved and is now going to tender. The other project that we have is Assumption Catholic School in Elmer, and that is going to be a 49-space infant preschool childcare, and we're hoping to have an announcement with regard to that later this week that I can share. And the other thing that just happened recently is we submitted to the ministry in partnership with the Ministry of Education and our two school boards, two additional childcare projects, both located in the county. And no information at this time because it was just submitted, but we are hopeful that these projects will be approved in the future. Next slide, please. Okay, before I move on to allowing this to move to my next colleague, did anyone have any questions about children's services in the county?
Any questions for Teresa? Please go ahead. Duncan.
Yes, thank you for your presentation. Mr. Warden, through you, just a quick question on the going to tender with the project at Albro Public School. We've been there before, have we not?
We have.
Okay.
So
'Cause I know
we had.
the municipality has issued a building permit, and that's as far as it ever went. So I'm just wondering who is advocating on behalf of this? Is it your group? Is it the Board of Education? Is it the Ministry of Education? Who do I get behind to cheer this on?
So I think we're in a good place right now. We are moving forward with tender. We had to adjust the size and the scope of the project, and that's what has taken a little bit of time because we had to do a little bit of changes with regard to the layout of the school. So the school board is leading this project. So I think that, if you wanted to connect with them, that would be the organization, I think, to connect with. But we are really happy that the ministry has approved this and we are able to move forward with this. So I have no concerns that this is going to not move forward. It is definitely going to move forward.
Okay, any kind of time frame for that, or?
As far as I know, the school board is the lead on this, and so they are moving forward with the tender. And so that's a machine that works that I don't know much about, but I can find out for you if you like.
Well, it will be what it will be, but certainly this is first time I'm hearing these. It is quite excited because it certainly is a demonstrated need in the communities. Thank you very much for moving this forward.
No problem.
Teresa, if you could get that information forwarded here to the county, we'll make sure that all the councillors receive it.
I will do that, no problem.
Thank you for that. Further questions for Teresa? Not seeing any. If you'd like to pass it on.
Sure, I will turn it over to Joanne Weber.
Okay, you're up, Joanne. Go ahead.
Okay, thank you. So next slide, please. So what you see before you is the vision and mandate of Ontario Works, and it's set out by the Ministry of Children, Community and Social Services. So a few things I'd like to draw your attention to on this slide. Ontario Works is both an employment and a financial program. So we provide employment and financial assistance to people in need. And the individuals we work with are accountable and responsible for working towards self-reliance through employment. And our responsibility is to provide financial assistance and employment supports in an effective way and be accountable to the taxpayer as well. Next slide, please. So what you see before you now, if you look at the center at the bottom of the screen, there's 4 kind of main programs for the Ontario Works program that we offer. There's Ontario Works Regular Benefits, and that's the program that provides for people in need. It provides the employment and the financial assistance. The second one is temporary care, and that assistance is provided to a caregiver who isn't legally responsible to care for a child. So often the cases are families are involved with Children's Aid Society, and the parent or parents aren't able to care for the child, and someone in the family in kinship picks up and decides to take on the child and take the responsibility on to care for the child. The third one is ODSP participating in Ontario Works. And that's similar to Ontario Works, but the financial part of it would come for the people from the Ontario Disability Support Program, and Ontario Works would help the spouses or dependent adults of the person that's disabled to find employment. And emergency assistance is something that's, it's been available before, but the guidelines were fairly tight. Because of COVID, the ministry has loosened up those guidelines, so we're able to offer this assistance to more people. As you can see, it's a very small amount of people that we have provided this to, but overall, but in December, we issued it to 11 different families. It's an assistance that for a temporary, like sort of a one-time need. So it's been great to be able to have that opportunity to offer it to more people. So on the left-hand side, you can see the average monthly caseload for Ontario Works. So we have approximately 1,500 cases. Those cases are divided by Ontario Works, the temp care, ODSP, and emergency assistance is quite small. So that's the number of cases, but a case could be more than one person in a case. So if you had a family, a parent with 3 children, that would be 4 individuals. So we serve approximately in a month, approximately 2,500 individuals each month. So that's what the circle is in the center. On the left-hand side, you can see our caseload for the last 3 years. And as you can see, 2020 has been quite a dip, and that could be attributed to the federal benefits that were available. They've definitely loosened those up and created some new benefits for people that would have traditionally been on Ontario Works. We have been advised by the ministry that in 2021, when the federal benefits end, which is targeted at the end of March, we'll see a 21% increase. So our caseload will be actually about 11% higher than it was in 2019. So the next thing I did looked at some numbers was I wanted to divide up to see where the people were residing. So 74% of our clients' cases are residing in the city of St. Thomas, and 26%, are residents of Elgin County. So next slide, please. So what I've done is divided this up in the areas so you can see where the people are living across the county. So that gives you a sense of where people are located. If I can go next slide. On this slide is some caseload demographics, so you can have a sense of the people that we're working with. So the majority of the people we're working with fall under the singles without children. We have a next largest category are singles with children, and then couples with and without children are a smaller part of the people that we serve. I've also divided out the education levels too, so you could have a sense of what education level the people are that we're working with. And I've also divided it by the age of the head of the family, so you can see the age category. Next slide. So one thing I always like to talk about when I talk about Ontario Works is the rates, because there's sometimes some misconceptions out there. So a single person receiving Ontario Works benefits receives $733 a month. So that $733 is broken down to basic needs and shelter. So the basic needs is meant to be your food, your clothing, transportation, toiletry items. That's what your basic needs is considered. Your shelter, the ministry considers, is $390 a month. So you can see by those amounts that it would be extremely, if not impossible, to find a place for $390 a month to live. So often people are dipping into their basic needs just to cover the shelter costs. And I've also broke down there for a single person with one child. They receive just over $1,000 from Ontario Works, but they would receive approximately $685 on top of that through federal and provincial child tax benefits. So our goal when we're working with clients is for they become self-reliant. So there's about 30% of our people right now are deferred. And what that means is they're not able to participate in Ontario Works activities right now to move towards employment. The majority of those cases are people that have medical issues, and we have a document on file that they're unable to participate. 70% are actively participating, but it's a full range of services. Some people we have to start at life stabilization to help them find housing, to help them find some medical supports, and other people, it's a full range to helping them to look for employment and find employment and then maintain that employment. So it's quite a wide range of people that we're working with, and we individualize it to each person. So I did do a little bit of comparison of 2019 and 2020 numbers. So because of COVID, unfortunately, our employment numbers are down. So our percent of our caseload that have employment earnings went down by 30%. Interestingly enough, the average monthly earnings per case was almost the same, went down by 1%. And our terminations exiting employment went down as well. Next slide, please. So our main office is situated in St. Thomas, but we do have 2 satellite locations. I've been able to go out to see the Elmer Community Services site, but I haven't had the opportunity yet to go out to West Elgin Support Services. So I'm quite anxious when things open up so I can get out in the community more. So in Elmer on the east side, that office supports the populations of Malahide and Bayham, and we have 2 caseworkers there. The one person speaks Low German and is a specialized addiction worker. Pre-COVID, there was someone in that office 5 days per week to meet with clients. In West Elgin, it serves a population of Dutton, Dunwich, and West Elgin, and there's 1 caseworker there, and she was there 2 days per week pre-COVID. So we adjust numbers depending on how many people we can change based on our caseload size in those communities. The other thing to point out that I think is really important, I think was set up before my time coming here, but is great, is that it's the same caseworkers that are always in those locations. So they get an opportunity to work with the community partners really closely and learn the community flavor, know what agencies to deal with and who to work with. So it's been really wonderful to have them out in the community. So the folks that live in Southwood and Central Elgin, they come into our main office in St. Thomas. Next slide, please. So social systems modernization. This started long while ago when Kathleen Wynne was in. They started on a path to modernize social assistance. So it's been a great ride as far as they've been really working hard to reduce the paperwork and the administrative. It's quite a heavily administrative program. So they've been working towards that, and they have more exciting things down the road. But for InteriWorks participants, it's worked out really well during COVID because there's an online application. People can apply for social assistance. If someone has been on assistance in the past and needs to reapply, there's a simplified process that's been set up. We have another delivery method for payments. So we used to have check and direct bank deposit, and now we have reloadable payment cards. And that's been ideal for the people that aren't able to get a bank account because they don't have sufficient ID to open an account. They eliminated the paper drug card. So it used to be if you needed a prescription, you had to bring that piece of paper into your pharmacy. Now that information is on people's Ontario health cards. They made enhancements to My Benefits and interactive voice response system. And those are two self-service options for clients to find out information about their case. And for the service providers and vendors, we're able to set up direct bank deposits for them as well. And we're able to consolidate the payments. So rather than the vendor receiving multiple checks throughout the month, they can receive it rolled up into one check. And there's also a helpline for healthcare professionals. So if a pharmacist, for example, is wanting to determine its eligibility for InteriWorks, they have a special line that they can call. So everything that takes a little bit of time to learn new processes in place, but once we get them in, it really does reduce the administration. That gives us more time to focus on our clients and with the goal to improve experience for our clients and the outcomes. So that's the end of my presentation. I thank you very much for listening. Did anyone have any questions?
Any questions for Joanne? I'm not seeing any, Joanne. Certainly thank you for that.
Thank you.
And we have one more from Danielle. When you're ready, go ahead. Welcome. Are you muted?
My apologies. It took me a moment there to unmute myself.
That's okay. I know the feeling.
Your Worship and to County Council, thank you very much for the opportunity to be here with you this morning and provide you with an overview of housing and homelessness services in Elgin County. Next slide, please. I thought I would start by providing you with an overview of social housing within the St. Thomas and Elgin County area. In total, there are 1,123 social housing units. Within that total number, 334 are located throughout Elgin County. Social housing units include units with subsidized rents that are owned and operated by the City of St. Thomas and Elgin County and by designated social housing providers. Subsidized rents on these units include rent geared to income for some units, and for other units, they may be receiving a rent subsidy, such as the portable housing allowance. By the end of 2020, the total number of households on the centralized social housing waitlist was just over 800. This included 220 Elgin County households. Wait times for social housing are based on unit vacancy, which varies based on unit selection and building. They could be as long as 1 to 5 or more years. For example, the current wait times for a 2-bedroom in Port Burwell or a 1-bedroom in West Lorne is set at 2 to 3 years. At any time, applicants are able to switch their unit selection while on the social housing waitlist. Next slide, please. Next, I'd like to provide you with an overview of the Social Services Relief Funds. So this is a provincially funded program as a direct response to COVID-19. It aims to help protect the health and safety of Ontario's most vulnerable citizens, and it intends to support municipalities and social service providers such as shelters, food banks, emergency services, charities, nonprofits to continue to deliver their critical services while keeping clients safe and healthy. In Elgin County, SSRF applications were approved to provide financial assistance to congregate care homes and to support rural homelessness and housing challenges due to COVID-19 in both East and West Elgin. Phase 1 SSRF was provided for operating costs for a total of $1.787 million for the period of March 23, 2020 to March 31, 2021. 2 public calls for applications occurred. All applications received were approved, and service providers received SSRF assistance to support them in serving our most vulnerable while adhering to COVID-19 safety protocols. In addition to SSRF provided for congregate care homes, SSRF funding was provided to collaboratives in both East and West Elgin who are supporting individuals and families at risk of or experiencing homelessness. Like many other aspects of homelessness, COVID-19 has acted as a lightning rod in exposing the existence and unique characteristics of rural homelessness. Work is currently underway in both East and West Elgin to better address this challenge, and I will speak more to that throughout this presentation. In addition to Phase 1 SSRF funding, Phase 2 SSRF was provided to our community for both operating and capital costs in a total amount of $1.263 million. Phase 2 SSRF funds have been committed towards the purchase of 10 Princess in St. Thomas and towards the new affordable housing built in Elmer. Next slide, please. Next, I would like to provide you with an overview of the Community Homelessness Prevention Initiative, also known as CHIPPY. This again is a provincially funded program that aims to prevent and address and reduce homelessness. The 2 key outcomes of CHIPPY are helping people experiencing homelessness obtain and retain their housing and ensuring that people at risk of homelessness remain housed. CHIPPY applications have been approved to provide financial assistance for rural homelessness initiatives in both East and West Elgin. The total amount of CHIPPY funding for the last fiscal year and the upcoming one remains the same at $1.459 million. A portion of CHIPPY is used to fund the St. Thomas and Elgin County HELP program, which aims to prevent an occurrence of homelessness by providing financial assistance for rent and utility relief. In 2020, approximately 70 Elgin County households accessed the HELP program. In a response to what we are learning about rural homelessness in our county, this year's CHIPPY application was provided to collaboratives in both West and East Elgin. The applications for funding we received back were included in the next CHIPPY fiscal investment plan, which was approved by St. Thomas Council last evening. The funding includes financial assistance for existing services and supports, and in addition, it includes financial assistance to pilot a new initiative through a dedicated Elgin County Rural Homelessness System Navigator position. As part of, next slide, please. As part of this presentation, I wanted to take the time to highlight some of the initiatives that are happening in the county to respond to rural homelessness challenges. In East Elgin, Family Central Apartments, for example, has been providing supportive housing to members of its community. And what we know is that this is a best practice for achieving housing stability. We are seeing more and more that this is the direction the province is moving towards, and it's great that this model already exists in our county. In addition, Family Central Apartments has been providing strong leadership to support vulnerable members of its community who are at risk of or currently experiencing homelessness. They are regularly exploring new ways to address the needs that they are observing and are in frequent and regular contact with our social services office. Additionally, the East Elgin Housing Initiative, through their winter emergency shelter response, has been operating since November. This is through the commitment and dedication of their volunteers. Their average number of guests per night is currently 2, with the highest being 6 and the lowest being 0. In total, 19 individuals have accessed the emergency shelter so far this winter. I would also like to take a brief moment to highlight the work of the East Elgin Community Assistance Program, which has worked to keep its doors open throughout the pandemic to provide food and other emergency assistance to community members in need. Similarly, in the West Elgin Community Health Center has been a great resource to vulnerable members of its community and has been leading on providing a response that addresses the unique challenges of rural homelessness. Since March of 2020, West Elgin Community Health Resource Center has responded to 13 unique homelessness crises. Out of their great work and leadership, a homeless coalition has formed that includes more than 30 committed participants from many different backgrounds, including myself. The level of interest has provided the coalition with the opportunity to form a steering committee and 2 working groups to focus on short-term emergency solutions and mid to long-term housing solutions. The emergency shelter group has had its first meeting and are working towards opening an interim winter emergency shelter response for March 1st through the Grace Anglican Church and in partnership with West Elgin Community Health Center. Next slide, please. I wanted to take a moment to also highlight for you some of the unique characteristics of rural homelessness. Rural homelessness is a social issue that has historically been overlooked, as homelessness has often been misunderstood as an issue that affects larger urban settings, when in fact homelessness is a complex human and social issue. In the last couple of years, and especially throughout 2020, advocates in rural communities have brought rural homelessness into focus, and more information and a better understanding of rural homelessness is now emerging. One of the unique characteristics that we are beginning to understand is while there may be fewer people experiencing homelessness in rural settings, there is a higher prevalence of hidden homelessness. And this might include couch surfing through friends and families' homes, as well as living unsheltered outside or in vehicles. What we are also beginning to learn is that rural homelessness is impacted by a lack of transportation in order to be able to get to services, and that often people don't want to leave their home communities necessarily to access those services. In addition, part of the information that's emerging is the concern for privacy in smaller settings where often there might be a tight-knit community and individuals are concerned for what it might mean for them to be labeled as homelessness. In Elgin County, we are working together not only to better understand rural homelessness, but to provide a response that will better meet these needs. Before closing my presentation, I wanted to take the opportunity to share with you the experience of an Elgin County citizen that was just recently supported through an experience of homelessness. Next slide, please. Jay is a senior citizen and a property owner in Elgin County. In the late fall, his property was deemed uninhabitable, and word of his situation made it to an Elgin County service provider. The service provider immediately made contact with Jay and began addressing his basic needs, including emergency shelter provision, amongst many other complexities related to Jay. In working with Jay, it was determined that there were no family members or friends who were able to help. Our social services office was contacted to be a part of finding a solution for Jay, so as he could not go back to his property, but also did not want to give it up. While uninhabitable, Jay's property is an asset that makes him ineligible under the Housing Services Act for many social housing supports, even though his monthly income is limited. Over the course of multiple weeks, the Elgin County service provider worked closely with Jay to continue meeting his basic needs, which were growing in complexity, while still trying to seek out a housing solution. In January, Jay required hospitalization. While in hospital, the service provider continued conversations with our social services office to find a solution. 2 options were identified. Jay could rent a private unit available immediately in Elgin County, or if Jay was willing to reconsider selling his property within a 6-month period, he could apply for social housing and be matched to a unit designated for seniors, also available immediately. After significant consideration, Jay chose the social housing unit, and earlier this month, he signed his lease and picked up his keys. Working together, Jay is receiving support to move into and set up his new home, and ongoing housing stability supports are being made available to him to help him anchor into his new home. That concludes my presentation. Thank you again for the opportunity, and I would be happy to receive any of your questions.
Mr. Warden?
Go ahead. Go ahead.
Yeah, it's Bob Purcell. This is more a request for Heather and her team. I would ask that you send your presentation direct to each of the lower tiers, attention the mayor, and specifically ask us to share it with local groups, individuals, etc. As you know, with the experience in the West End and some homelessness, there's a lot of communication issues. But once the right people get in the room together, things seem to get resolved fairly quickly or head in the right direction. So if you'd send that to us, it's full of great information, great contacts, and we can share that with all of our our local people.
I'm happy to do that. Thank you.
That's a great idea, Councillor Purcell. Further questions?
Mr. Warden, could I make a comment, please?
Certainly, go ahead.
Oh, I'd like to thank Heather and her team for presenting. It really is enlightening and it gives us a lot of information. Also, I do agree with Councillor Purcell that that will be a great advantage if all the councils are privy to the material. There's a lot of questions out there. There's a lot of concerns and people are confused. They still don't really know where they're supposed to go or what they're supposed to do. Also, if it's not asking too much, if there's any more budget information you can share with maybe some breakdowns of where the money goes for the homelessness and in our communities and those types of things, just to give us a bit more information, because people are confused about who's in charge of social services. A lot of people come to, I'll say the town of Elmer, because I'm speaking as the mayor in this case, and I tell them that's we don't do that in Elmer. But so I need to know more information about the budgets and how they work and what's available. So if you don't mind doing that, I would really appreciate it. And thanks
Sure.
again.
Yes, no problem.
Yes, I'm seeing heads nodding in agreement, so further questions for the ladies?
Sally Martin.
Go ahead.
I just wanted to commend Heather and her whole team for the great work you're doing. This is a very difficult time and a lot of people have misunderstood social services. And I think it is important to get your information out so people realize the real need out there and understand what's going on. Thank you so much for what you do. We really appreciate it.
Thank you very much. I appreciate your support.
I agree. I think it is a refresher for a lot of us. Councillor McPhail?
Yes, Mr. Warden, thank you. Just going back to the tendering announcement at the Albro Public School, is this just a recent announcement or an initiative that has taken place?
No, thank you, Councillor McPhail, for addressing that. I actually just sent an email to the school board to clarify, because I was under the impression that we were ready to go. We are still waiting for one more approval to go to tender, but we have had numerous conversations with the ministry and they are very, very positive about that moving forward. I apologize for that because I truly was under the impression that it was ready to go. We're still waiting for one more thing because there has been one small change. But as soon as we get that approval, I will ensure that I notify everybody in council to let them know.
All right, thank you for that. If there's no further questions, I want to thank Heather, Teresa, Joanne, and Danielle once more. Appreciate the presentation. Stay safe. Thank you.
Thank you.
Thank you.
We need a mover and seconder to receive, please. Purcell and Ketchabah. Please call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Jiguer.
Yes.
Councillor Ketchabah.
Yes.
Mr. Warden.
Yes,
9-0, the motion is carried.
thank you for that. Do we know if Mr. Crane has had success?
Hello, it's Jim Crane here.
All right. If you're ready, Jim.
Yes, you're giving me the honor to speak now, are you?
I think we're all set. Yeah, the floor is yours, Jim. Welcome. Go ahead.
Okay, I want to thank you for taking this on, the council and the staff to be able to speak today. What I'm speaking about is the Crane Conservation and how I feel it's a black eye to the Lower Thames Conservation. What has happened here, it's actually a black eye to Elgin County and the legacy of my uncle, Dr. James W. Crane. He's rolling over his grave over this. This is what, having this property sold the way it was is very wrong. Anyways, I'm going to give you a little history of Dr. Crane. He was born in Orwell in 1877. I'm not going to go a lot of elaborations. He went to high school in St. Thomas. He went to university in Toronto to get his doctor's degree, as it was awarded in those days. And anyways, became a doctor. Was up north of London for a year in Iona Station, another 12 years in Wallacestown, and then he moved on to London and was going to be a doctor there. And I guess there were some people from the University of Western Ontario felt that he'd make a great teacher or lecturer. So he got involved in the university and actually became dean of the medical center at one point in time. So he was a professor there for many years. Anyways, moving on, I guess we'll go into a little more of the history of the property now. Out there at Iona Station, that was my great uncle's summer home. Purchased it, I believe, 1936. By 1938, he decides, with the help of his brother-in-law and some other people, to plant a conservation park out there. He was a great conservationist. And to go back a step farther, he had my dad, as a young boy, plant an 18-acre bush lot, which is just about 3 kilometers southwest of Elmer, which we still own today. And we consider it a conservation bush lot. And we've never logged it, and we've had many opportunities to sell it, but we're hanging on it, sort of thing. Anyways, and so in 1955, this property, this almost 8-acre property that he planted the trees on, was donated to the University of Western Ontario. I don't personally remember that happening, but I do. But it was sold for $1. I do have records of that. I do remember when my uncle died in 1959. He died in the St. Thomas Elgin General Hospital at the age of 82. In 1961, about 16 months after my uncle passed away, the university decided to pass this property on to the county of Elgin, which for $1 again, and it was accepted. And there was actually ceremonies at that time. A brass plaque was put up in his memory with a lot of his things that he'd done over the years, achievements, I should say, and a nice monument there, and which still stands there today. So anyways, we're going to jump ahead now to 1976. The county, I guess, felt that they did feel they weren't the people to be having it, because I did have a few meetings with county engineer at that time, Robert Moore, and anyways, he assured me when that property was sold again for $1 that the Lower Thames Conservation were the people to preserve it, and it would be preserved as a conservation park. So I had to agree with him. It's a conservation area. They're the people that should be looking after it. And so, anyways, now I'm going to go ahead and say I've been talking to the conservation, and the reason they sold the property is there's 3 reasons. They didn't like paying the taxes on the property, but I think that's kind of normal with conservation areas. There was dead trees in there. I guess every bush lot's got dead ash in it. But anyways, that was one of the reasons. And the other reason was they're going to have to pay money towards a municipal drain, and they didn't want to pay that. So anyways, I'm going to move on to the next step. Last week, Mr. Van Wagner states on radio that there's only 2 acres of trees left there, and only a few species. And in 2015, June the 25th, 2015, Conservation actually had a road tour of their eastern parts of the Lower Thames Conservation. And it's documented here. They made a stop there, and they were told, I guess they did a walking tour, because they was documented to make sure you wear good walking shoes, and I can't prove they walked it, but what it says here, Crane Conservation, 3-hectare property, donated 1976 by Dr. James Wellington Crane, planted trees between 85 and 90 different species. It's changed hands many times, it says, which, well, that's true. It has changed hands many times. But at that point in time, it certainly sounds like the park was in full flight, and even though it did get sold. Anyways, I guess the next thing I want to talk about, the property being sold for $9,000. And anyways, I got that information through 2 or 3 real estate agents, and I think I sent you a document to prove what I'm saying, because that information wasn't able to get that through the lower Thames Conservation or the gentleman that bought it, which I did talk to about this. Now, just this past Sunday night, I was talking to a gentleman, I'm sure many of you know, Dan McKillop. And actually, it was the night of the Super Bowl. And he was a board member at the time this sale went through in 2018. I think he was still in politics till the fall of 2018. But I asked him, did you appraise this property? And I said, it's a double question. Are you an official appraiser, certified appraiser? No, I'm not a certified appraiser, he says. Did you appraise that property? And he was a little reluctant to speak on this. And I said, well, somebody appraised it. There's documentation saying that. Well, he ended up saying that there was a group of them got involved from the conservation, and they decided that was a fair price, and they actually come up, I believe, with $20,000, but they felt that the drain was going to cost about $11,000, so they sold it for, that's how they put on it for a price, $9,000. And there was the key why it was sold so cheap is what I'm being told. There was only 3 people who could bid on that property. The gentleman that bought it, Mr. Engelhardt, the person to the south of it, which has a little 6-acre parcel, whom I spoke to yesterday, don't feel they were, if they had the proper paperwork on it, they certainly would have been interested in it, but they feel the lady felt they were very fluffed off on it and didn't get much of a chance to buy it. And I did talk to the gentleman who owns the property back behind it, and he was in favor of Mr. Engelhardt buying it. So trying to be very honest about this. Anyways, I guess the next thing I want to talk about is just one second. I want to read this document to you. You have this document, but this is what it says. Please find below the considerations the board discussed in discussions to sell the Crane property. The Crane property was sold with a number of significant restrictions based on preservation of the arboretum wooded portion of the property planted by Professor Crane, who donated the property. So I think that's pretty clear. Number 1, restrictions are in place such that access is not available from Elgin County Road 14. And I think we have to agree that's the Iona Road. This access would cut into the arboretum and compromise its environmental value. And additionally, the board considered this access would be against the wishes of the donor. I would have to think they're possibly even thinking my old uncle on that one, but it might be just the county, I'm not sure. The rear of the property is developable, open area and plantation with access at the rear of the lot outside the arboretum. This would have to be achieved by a neighboring landowner's serving access corridor to these lands due to the arboretum access restriction. So I guess that means that if anybody wants to enter that property, they can't enter it from the road. They have to enter it from the backs of their own property in some type of manner. Number 3, neighboring landowners were approached and only one was interested in the property. Bit of a gray area there. Without this access, this number 4, without this access, there was a concern that the property would be purchased by someone who would not build but would carry out illegal developments, use activities in the open rear of the lot. Not 100% sure what that means, but it's stated. Number 5, the property was part of a municipal drain and works were being proposed significantly increase the cost of the property by selling the property. These costs were borne by the purchaser and landowner who was also on the drain. Well, I can agree with that one 100%. Number 6, the property was assessed by a certified land appraiser, and the sale cost was based on that appraisal. I don't think that a certified land appraiser is not a real estate agent that doesn't have a license to do that. I've certainly looked into that, so I think we got a bit of a problem there. Number 7, the purchaser was a relative of Professor Crane and committed to moving and maintaining the monument Karam Crane and his work on the property. Hope this provides a rational and for the purpose of your discussion. Now, as far as this gentleman being a relative, I'm not saying he isn't a distant cousin, but I'll tell you, he's a very distant cousin. To put that in there, saying he's a relative was just kind of put a little icing on the cake sort of thing, the way I would say that, because I've done research on the Cranes, lots of it. And I don't know if he's a relative. He's very distant. We'll put it that way. Anyways, I guess I talked about Dan McKillop. The phone. I don't need to talk about him anymore. The one other thing I would like to talk about maybe is the tree commissioner, Jeff Lawrence. Has he looked into the tree cutting? It certainly appears there's been several trees cut out of there, fairly large trees. I had a neighbor phone me on Sunday, a man and his wife, and they've been following this very closely, and they assure me that there were some large trees cut out of there and trucked out of there. And actually, the neighbor lady that I was talking to yesterday that lives on the other side of the property said there was definitely trees taken out of there, been trees taken out of there recently. And she also stated the park. It was kept, she's lived there 11 years, and she said the park has really gone downhill these last few years. Just nobody cared about it, and I guess I blame the conservation there totally for not taking an interest in it when it was given to them the way it was. And the reason they're selling it too is it's such a small acreage, but they do have other small acreage parks. And they're also saying, the conservation, and since they sold this property, even since they sold it, there's a document in the Chatham paper saying they're looking to take on more conservation areas, and if somebody had a 100-acre woodlot they wanted to donate in the memory of the family, they would certainly take it, and they would probably have it assessed, and it could be worth $1 million. So the family would get $1 million tax credit on that, so they could use that against their income tax, or it could go against their estate when they die. So I guess this conservation thing is it's pretty wishy-washy. Now, I want to say this I'm going to say it twice. I am not in this for personal gain. Jim Crane is not in this for personal gain. I'm only protecting the heritage of my great uncle, Dr. James W. Crane. And I'd like to see if any of you people got any questions. So I'm done my presentation.
Thank you for that, Jim. Before I allow questions, we have a bit of a summary from our CEO, Julie Gagnon. I'd ask her to give it, please.
Thanks, Mr. Warden. Through you to members of council. We did a bit of research into the land transfer information that was available to us both through our archives and within our administrative records. What we found was that currently any restrictive covenants must be registered to be enforceable. So letters don't constitute enforceable restrictive covenants registered against title to the property. There is nothing detailed on the parcel register that indicates at the date of conversion in 2007 that there were any enforceable restrictive covenants. Restrictions prior to 2007, which were still of legal effect, should have been noted. Either there were no such covenants or pre-existing covenants had expired by operation of the law. 40-year maximum is the effective term for any restrictive covenants. So the deed from Dr. Crane to the University of Western Ontario does not contain on its face any restrictive covenants as to either future ownership or use. As well, the deed from the University of Western Ontario to Elgin County does not include restrictive covenants on its face. So there was a letter discovered in Elgin archives that indicates University of Western Ontario did not require a formal agreement as to the intended use of lands received from Dr. Crane. Similarly, there are no restrictive covenants on the face of the deed from Elgin County to Lower Thames Valley Conservation Authority. The deed from Lower Thames Valley Conservation Authority to the current owner does not contain restrictive covenants on its face, but immediately following registration of the deed, the current owner registered restrictive covenants governing the use of property in satisfaction of the requirement from Lower Thames Valley Conservation Authority. So it is significant to note that Elgin did not receive title to the subject property directly from Dr. Crane. Based on the current parcel register, it does not appear that acquisition of the title to the lands by either the University of Western Ontario or Elgin County was subject to then existing restrictive covenants, and furthermore, neither University of Western Ontario nor Elgin County registered any such restrictive covenants prior to their respective disposition of title. University of Western Ontario to Elgin County and Elgin County to Lower Thames Valley Conservation Authority. So Elgin County transferred title to Lower Thames Valley Conservation Authority with no enforceable restrictive covenants, and in this regard, all relevant deeds reflected the same wording. So it is important to note that Elgin reserved no claims against the property and released all rights and interest to Lower Thames Valley Conservation Authority. At all times, Lower Thames Valley Conservation Authority, bound by established statutory and regulatory obligations and purposes. And Lower Thames Valley Conservation Authority is a legal entity which is separate from Elgin County. So Elgin staff, we have not yet completed a full title search, and if council directed such, and if ordered to do so, this type of search would commence with the transfer from Dr. Crane to the University of Western Ontario and would reflect the full chronology of the registered instruments, including those which were deleted from the parcel register during the conversion process in 2007. Though again, it is important to reinforce that there is a 40-year limitation on restrictive covenants. Thanks, Mr. Warden.
Thank you for that report.
I have a comment on that, if I could, please, Mr. Warden.
Go ahead.
Back in 1976, I still have a letter here from County Engineer Robert Moore. I was very concerned at that time. I was a young man then, but I got to know Robert Moore very well because I was very close friends in those days with our Reeve, J.B. Wilson. And anyways, I did get to know the man very well. And I did have a few meetings with him. And I was assured, and with a handshake from Robert Moore, that this property was in good hands, and it would remain a conservation area. I was suspicious, believe it or not, at the time. And anyways, I only have one letter left that he sent me. But anyways, they were working on it, and I guess I was brought up, a person's word is as good as their bond, and that bond's been broke here. This is not right what's happened, and somebody has to be made accountable for this.
All right, Jim, I'm going to open the floor here to the councilors to ask questions in a second. And I'm actually looking at the faces of our council members, and I know that we all agree with you. Your word is your word, and a handshake is as good in this day and age. Legalities aside, you made the phone call to me, and I granted permission to come to county council, have your say, and shine the spotlight on this situation, if you will. Where this goes after today, I'm not sure, but yeah, it's bothersome. I'm not prejudging anyone, I'm just here looking for information, same as you are. Lots of questions. I'm going to ask county council if they have questions right now.
Just a comment, Mr. Warden.
Go ahead. Councillor Martin, go ahead.
Okay, thank you. This does bother me greatly. I know it can't fix people, but a concern.
I can't hear you very well. Can you speak a little? I can't hear you, Mrs. Martin. Hello?
Okay.
Yeah, it's a bad connection.
Yeah. Okay, I'll turn off the video. That might help.
Go ahead.
I do have serious concerns about the fact that the donation, et cetera, has been lost, and the intent of the use of the land. And legally, we may not have anything we can do, but I know Catfish have been considering the same thing because we've had people approach us to purchase some of our lands, and so we're looking at our policies. And I strongly believe that something that's been donated or given for $1 should not be sold at a profit, and that it should remain in conservation land. So that's just my opinion. It is not a legal binding thing, but I think it's important that we, I do feel very strongly about this. Thank you.
Thank you, Mrs. Martin. Councillor Martin, or I should say Mayor Martin, I thank you for that comment. And I would like to comment further when that says, because that document that I read you, it says that property can't be built on. There was no building permit to be issued on that property, and all of a sudden there is a building permit. So there's another issue with this property, and there's been trees cut out of there I don't believe should have been cut out, especially when it was a conservation area. But anyways, I'd like to take any more questions there is.
Do we have further questions?
Mr. Warden?
Go ahead, Bob.
Yes,
Bob Purcell.
Bob Purcell. I'd be happy to move that we receive Mr. Crane's report and documentation, as we do with all presentations of delegations. We don't usually make decisions instantly. The other thing I would ask, if Mr. Crane is willing, he's referred to some documents he hasn't shared with us yet, some letters and whatnot. If he'd be kind enough to share those with us, I think that would be helpful.
I'll continue to work with you. I think I've sent you a lot of information. I actually sent Ward March a little bit extra stuff here just a day or so ago, because I didn't think it would make the agenda, but I certainly am willing to do that. And I can't tell you how many people I told the London, the TV station the other night, they actually phoned me back last Monday morning and wondered if it was all right if they handed out my phone number. And I said, by all means. And I'll tell you one thing, the support out there for this happen the way it has, it's a real black eye, I'll tell you, on the Lower Thames Conservation. A real black eye. And well, we'll see if he was legally could build on it like that, something went wrong there also. But I will keep you. I will make sure things get sent through as they come through. I'm looking to get the records from the university, and it's very difficult on the tree planting. Somebody's got those books. They're either in the Elgin County Archives or the university, because my uncle was a records keeper. I have many records of his that he kept, but I certainly don't have them on the planting those trees.
Thank you, Jim. Now we have a motion from Councillor Purcell to receive. If we have a seconder, we'll vote on that. I'm sure this is not going to end today. It's disturbing to a lot of us. I'm not going to prejudge anyone. People are still going to keep asking questions. But at this point, if I have a seconder, we will Ketchabaugh. So we have Purcell and Ketchabaugh. We'll call the vote on this to receive this report.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin. Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchabaugh.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
All right. Jim, I want to thank you. I'm sure this won't be over today. You're a diligent man. It's disturbing. I don't know where this will end, but I'm sure it's not going to end today. Thank you for the report, and you have a good day.
Thank you for letting me speak, and I really believe the conservation did this in a very underhanded way. You're talking about that 40 years. That's what you call dirty pool. And I'm sure when I get some more coverage with the media, they'll certainly report it as such, because I'm just not happy about this. But thank you for letting me speak. Bye for now.
Take care. That is the end of our delegations. Probably a appropriate time to take a 5-minute break. I'm seeing heads nod, so we will recess for 5 minutes. We're back live streaming, so we'll call the meeting back to order. We're ready to move into committee of the whole and entertain a motion for that, please.
So moved.
Mennel and French, please call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail. Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchabaugh.
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you. We're now back into Committee of the Whole. First report comes from me. And I would like to point out, I know we're all looking at a big agenda today. We are moving fairly well, and I just want to emphasize it. We'll try to keep the meeting moving, but each report is important, so I do not want to have anyone feel rushed. So if there's questions, make sure you ask the questions, and we'll get through this as quick as possible, but thoroughly. Having said that, my report on my activity for the month is there. I will not read it. I'm sure you all have read, but if there's questions, I'd do my best to answer them. If there's no questions, I entertain a motion to receive it. Moved by Purcell, second by Jones. Please call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you for that. That's carried. Staff reports. First up, Director of Home, Senior Services, Long-Term Care Home Service Accountability. Michelle, is that you?
Yes, it is. Thank you, Mr. Warden, through you to members of council. So before you is the report on the LSA, the Schedule E Declaration of Compliance. The report is self-explanatory, and there's just two recommendations, one that the report received and filed, and the second that council authorized the CEO and the warden to sign the Schedule E for the homes for period of January 1 to December 31st, 2020. And I'm happy to answer any questions you may have.
Thank you, Michelle. Do we have any questions for her? I'm not seeing any. Look for a mover and seconder, please.
So moved.
Mennel and Jones, please call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchba.
Yes.
Warden,
Yes,
9-0, the motion is carried.
thank you for that. Multi-year accessibility plan. I believe, Amy, you're going to deal with that?
I don't think Amy's on the line, so I'm happy to handle that one, Mr. Warden.
Go ahead.
Annually, we present updates on our accessibility plan, and the resolution before you is that the report titled Multi-Year Accessibility Plan 2020 Annual Status Report, which we submit to the ministry, be received and filed. We'd be happy to answer any questions you might have.
Questions for Julie? I would point out that I sit on that committee. We had our first meeting in over a week or so ago. Sam does a great job, and we have a great chairman and a good committee. So they were very excited at the news of the elevator, new entrance and stuff. So if there's no further questions, look for mover and seconder, please. Moved by French, second by Giguère. Thank you. Call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you for that. Next, Economic Development Coordinator, Local Business Support and Workforce Initiatives.
Good morning, Mr. Warden, and through you to members of council. Council has identified a number of priorities in your strategic plan that have close links to economic development and tourism. This lengthy report details our department's work in the areas of workforce development and support for businesses during the pandemic, along with information about what work is happening locally. I would be pleased to answer any questions that you might have. Thank you.
Thank you, Jessica. Do we have any questions? A good thorough report. Not seeing any questions. Looking for a mover. Councillor McPhail, are you moving that or a question? You're muted. You're muted, Duncan.
All right, let's start over again. I will certainly move that, but I also have a question, and I see we are putting $5,000 from the Economic Development Department 2021 operating budget, which is certainly, I think, a good investment. Is there this going to be an expensive budget line moving forward, or are we not in for a whole lot of money?
As of right now, through you, Mr. Warden, as of right now, this is the only item with workforce development and for local business support that has been budgeted.
I'll move that, Mr. Warden.
Okay, thank you for that. Moved by McPhail. Do we have a seconder, please? Purcell, please call the vote.
Deputy Warden Mennel,
Yes.
Councillor McPhail,
Yes.
Councillor Purcell,
Yes.
Councillor Martin,
Yes.
Councillor Jones,
Yes.
Councillor French,
Yes.
Councillor Jiguer,
Yes.
Councillor Ketchba,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you for that. Next up, we've got purchasing coordinator.
Thank you, Mr. Warden, through you to County Council. This is can you hear me?
Yes, go ahead, Mike.
Okay, sorry. So this is my procurement activity report for the fourth quarter of 2020. The details and the contracts awarded are listed in Appendix A. The recommendation is the report be received and filed, and I'd be pleased to answer any questions.
Thanks, Mike. Questions for Mike? Good report.
I'll move the recommendation.
Moved by Mennel. Second by,
Martin.
thank you for that. Please call the vote.
Deputy Warden Mennel,
Yes.
Councillor McPhail,
Yes.
Councillor Purcell,
Yes.
Councillor Martin,
Yes.
Councillor Jones,
Yes.
Councillor French,
Yes.
Councillor Jiguer,
Yes.
Councillor Ketchba,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you for that. Next up is manager planning, final plan of subdivision approval, the Ridge, Talbotville. Nancy, welcome.
Thank you. Through you, Mr. Warden, through to members of council, I thought the first item was the draft plan consideration, but that's okay. I'll do this. The next, this report is the final approval of a plan of subdivision in the township of Southwold for 57 lots and one future residential block that was recently approved. I'm available for any questions that you may have.
Did I skip ahead? I think it's bifocals. I'm sorry.
You threw me.
Not on purpose, bifocals. Questions for Nancy? I apologize for that. All right, mover and seconder for that, please. Jones. Seconder. French. All right, please call the vote.
Deputy Warden Mennel,
Yes.
Councillor McPhail,
Yes.
Councillor Purcell,
Yes.
Councillor Martin,
Yes.
Councillor Jones,
Yes.
Councillor French,
Yes.
Councillor Jiguer,
Yes.
Councillor Ketchba,
Yes.
Mr. Warden,
Yes.
9-0, the motion is carried.
All right, I do apologize. I think we're manager planning again, but draft plan of subdivision, Jacqueline Farms, the other side of the. Go ahead, please.
Thank you, Mr. Warden. Through you to members of council, the attached report is for consideration and approval of a draft plan of subdivision for the Jacqueline Farms Phase 4 subdivision, which is located in central Elgin. I'm available for any questions. Thank you.
Do we have any questions on the application? See none, looking for mover and seconder, please.
Martin, move.
Seconder. And Martin and Jones, please call the vote.
Deputy Warden Mennel,
Yes.
Councillor McPhail, Councillor McPhail. Thank you. Councillor Purcell,
Yes.
Counselor Martin. Counselor Jones.
Yes.
Counselor French.
Yes.
Counselor Jiguer.
Yes.
Counselor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Checking, is this Director of Community and Cultural Service? Am I back on track? Okay. Brian, go ahead. Thank you.
Yeah. Thank you, Mr. Warden. And through you to County Council, this report recommends a new appointee to the Elgin County Museum Advisory Committee on behalf of the Western branches of the Women's Institutes. Donna Lord of the Middlemarch branch is being recommended for appointment to a 4-year term. I've also outlined the other members who have been previously appointed and continue to serve, including Councillor Martin on behalf of County Council. This appointment is to replace Helen Van Brink, who is certainly well known to members of council and has devoted 16 years of service to the committee and the museum, including the past 7 as chair. She's also been a tireless advocate on behalf of the Women's Institutes over many years and played a central role in our ability to acquire Tweedsmuir histories from across the county, which are an invaluable historical resource. Her service will certainly be missed, which is why we are recommending that the warden, on behalf of council, issue a letter of appreciation for all that she has done. With that, I'm happy to answer any questions.
Thank you, Brian. I'd be most happy to send that letter. Certainly very well deserved. Any questions for Brian? Are we ready to receive? Mover and seconder, please. Purcell, Ketchba, please call the vote.
Deputy Warden Mennel.
Yes.
Counselor McPhail.
Yes.
Counselor Purcell.
Yes.
Counselor Martin.
Yes.
Counselor Jones.
Yes.
Counselor French.
Yes.
Counselor Jiguer.
Yes.
Counselor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Thank you for that. Director of Community and Cultural Services, elimination of e-green recycling program. Go ahead.
Okay, thank you, Mr. Warden. Through you to County Council, this report informs Council that the library's e-green recycling program has now been eliminated. The company that supported this service in partnership with the Steam Center in St. Thomas no longer has the capacity to provide the service, and we've not been able to identify a similar service provider to go forward. Nevertheless, the program did have a good run at the 5 branches. We collected over 75,000 kilograms of e-waste, and while at the same time benefiting the Steam Center in St. Thomas in terms of refurbished items and revenue off the e-waste. The Steam Center wishes to inform the public that it will continue to accept used desktops, laptops, and tablets at its St. Thomas location, which are refurbished for use by students, Indigenous communities, and those with limited means. And with that, I'll answer any questions you might have.
Is that a question, Grant, or? Grant, you're muted, I believe.
Through you to Brian. Brian, could you forward on the address? I know it was well used at the Shedden branch, and I know people have asked where they could take items, and it'd be appreciated if you give me an address for that. And if there's a time, is there a time slot where you have to deliver as well?
Sure, through you, Mr. Warden, I'll gladly provide that information to council. And while we're on that too, we do are open to suggestions from our partners regarding other options that we may be able to consider, including e-waste bins on the site of library branches in place of this. If you're looking for, if you know of initiatives, we're certainly all ears in terms of how we can go forward with this.
Thank you for that. Certainly with a lot of people at home, I know there's been a lot of house cleaning and stuff being moved closer to the door to be recycled. So, mover and seconder for the report, please. Jones, seconder, please, and Mennel. Call the vote, please.
Deputy Warden Mennel.
Yes.
Counselor McPhail.
Yes.
Counselor Purcell.
Yes.
Counselor Martin.
Yes.
Counselor Jones.
Yes.
Counselor French.
Yes.
Counselor Jiguer.
Yes.
Counselor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Thank you. Elgin County Library Service update. Ryan, still?
Yep. Thank you, Mr. Warden, and through you to council. I wanted to give council this update on the status of library services at the moment, and really, frankly, how well it's been received in recent months. The stats are in the report, and I won't go through those in great detail for you. We're certainly willing to answer any questions about them. Also got Natalie here in case you have any further questions. I've listed in the report the many technology upgrades we've made, such as self-checkout and wireless printing, which will serve us well going forward and post-pandemic. And I want to thank our IT department. They've been really stretched thinly these days, but they worked with us to implement a lot of this technology. A lot of it was first-time technology. And so, again, I want to thank them for all the excellent work they've done in rolling this out. And to also note the significant reduction in revenue we have experienced in 2020, and like we'll experience again in 2021. We can mitigate this decline for now, but we may be seeing a new operational reality when it comes to fines and fees, and we can certainly bring forward options for councils to consider on this matter. And relative to recent fine-free movements that systems around us, such as London, St. Thomas, and Oxford, have taken. I also want to say what a relief it was for us in the latest lockdown that the library curbside service was allowed to remain open. I think this is a reflection of the important role that our services are playing in the mental health and well-being of residents as they cope through this pandemic. And we are certainly seeing that reflected both, particularly at the curbside, with strong uptake. We're hopeful that we can return to some level of curbside plus that we had previously put in place as a result of the announcements in the whatever zone we're able to move into next week. And from there, start the process of building out our services. But for the time being, we're very pleased with how the service has been received. And I just want to bring this report forward for your information and happy to answer any questions you might have.
Thanks, Brian. Any questions for Brian? Not seeing any. All right, a mover and seconder for the report, please. Jaguar, McPhail, call the vote, please.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Jaguar.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Thank you. Over to another Brian. Go ahead, Brian.
Thank you, Mr. Warden. Through you to County Council. This first report detailing zero emissions vehicle infrastructure program specifically details 2 electric vehicle charging options for council's consideration, for which staff is seeking direction, permitting either the public to charge an electric vehicle for free or for a reasonable hourly charging fee, subject to procurement of a specific vendor's charging hardware. Staff estimates the cost to charge an electric vehicle is anticipated to cost approximately $1.60 per hour. With that, I'd be happy to answer any questions.
Questions for Brian?
I
Yes, sir.
agree with.
Go ahead, Sally.
I agree with Brian, and I think that we should charge for it. It's nice to do it for free, but I think it should be charged. And the other thing is, I think there should be a time limit, because I have experienced some problems at places where you go and the vehicle's just left there all day and nobody else can use it. So I think somehow there needs to be a time limit put on them. I don't know how we monitor that, or if the machine can be allowed to turn off and they have to move their vehicle or what. I don't know, but that would just be an idea I have that I would think we should look into.
Thank you for that. Certainly, we do not want it to become a parking lot spot. Further questions, comments? Certainly with the news in Ingersoll at the Cami plant, electric vehicles are coming. I remember in my days on the Earth Board, they said that, and they said it will be here before we know it, and it sort of sounds like it's happening. So if there's no further questions, I entertain a motion to receive.
So moved.
Mennel, Purcell, call the vote, please.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yep.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Jaguar.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
All right, thank you for that. and Director of Engineering Services, Manager of Corporate Facilities, Administration Building, Council Chamber, Main Entrance Lobby Reception.
Point of order, Mr. Warden. Just a point of clarification. Did staff get the direction they wanted on that last report?
No, council just received the report.
So Councilor Martin
Do they want the direction?
Yes.
Okay, I apologize again. Remind me again the direction, or is it about?
So direction with respect to whether to charge
Yes.
the public a
Yes.
nominal fee to charge their electric vehicles.
I'm certainly in favor of that.
Well, then I will so move.
All right. And we have McPhail can second that. So we're giving direction for staff to come back with some mechanism that can happen?
We'll come up with a follow-up report, yes.
Okay, follow-up report. So the motion is moved by Ketchabah and McPhail. If we're ready, call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Jiguer.
Yes.
Councillor Ketchabah.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
All right, thank you for that. Administration building, I think we're up there now, Brian.
Thank you, Mr. Warden, through to council. Before you are several conceptual design alternatives for either a remodeled or expanded council chamber space for council's consideration, for which staff is requesting direction. Staff, upon review of various alternatives, staff felt it best to give council and detail all potential alternatives. And so with that, we'd be happy to answer any questions.
Thanks, Brian. I would like to point out, I want to thank staff because this is a thorough report, a lot of ideas. But they've looked at all, 10 years, 20 years from now, another council can be sitting here. Sometimes we'll say, well, why didn't they do it then or whatever? This is a thorough report giving us all the options. Wait for the council to make a decision which direction we're going to go, but it is a thorough report, lots of good ideas. Councillor Mennel, like to speak, go ahead.
Thank you, Mr. Warden. I kind of look at this as doing the shingles on the south part of your house. It's still good for another year or so, but I don't think we want to do half a job. And I would suggest that we pass this over to, certainly I'm in favor of doing the whole thing, but I think the budget committee, they're meeting this afternoon. I would recommend that we turn this over to the budget committee and get a recommendation from them.
Councillor Jones.
I would have to agree with Councillor Rennell. I think if you're going to do it right the first time, it's going to be cheaper in the long run. Obviously, the finance committee is going to have and Jim are going to have to figure it out. But personally, just from personal experience in construction over the years, just do it right the first time.
Further discussions? Go ahead, Councillor McPhail.
Somebody clarify to me what doing it right is.
Good comment. I'm looking at the first four recommendations around the 100,000. That big next step is a big one. I'm wondering, rather than taking it to budget, I think we got an opportunity here for good input from everyone. Further comments? Jones?
It just seems to me we've in previous terms of council talked about this. I think when I first came on council 8 years ago or so, we were talking about this, and we were looking at a new build with a combination of POA and the council chambers and administration building, and it should have happened then, but funding wasn't there for it. Obviously, that was a big deterrent at that point. But I think we've built ourselves into a corner, unfortunately. But where options are not as advantageous as it was back then. But it's like Dave said, it looks like it's just putting a Band-Aid on a problem, and at some point we'll be back to square one someplace down the road. We're going, what are we going to do now?
McPhail?
Just for definitions, can somebody outline to me what the problem is?
Anyone want to answer that? Jones?
It's a very old building. That's the biggest problem.
Okay. I have a question for Brian. If we choose one of these first four options, and that has been maybe putting lipstick on a pig, I've heard that reference. If a future council, whether it be 4 years, 14 years, 24 years, decide to go and do that's still an option, is it not? Knock some walls out and do it then?
Yes, through you, Mr. Warden, absolutely. Expansion of chamber space can occur at any point in the future. I would say more simplistically from staff's perspective, does council prefer a remodeled solution or an expanded solution? And quite frankly, we can iron out seating arrangements as part of future presentations to council.
Well, during this journey, this past year, we've identified certainly connectivity with its challenges, and one of the biggest challenges is funding for that. We just went through a pretty sad homeless presentation, social services presentation that can really pull on the heartstrings. Even through the worst of conditions, we're still operating. So, further comments?
I'll make a comment, please, Mr. Warden.
Go ahead, Councillor French.
It's good, and I think we do need to look at this, but I think that this isn't the time, unfortunately, because we don't want to bite off more than we can chew, and we are certainly looking at a lot of projects. And also, it's an uncertain time because with COVID-19 still prevalent, and we've got costs that we don't even know what's going to end up with our budget for next year. The only thing I can say is if we don't do some renovations and we do decide to do the expansion, why don't we look at it for the next 2 or 3 years? Maybe we could put something in the budget and work on that and then work towards that. So make it a project, but do it over, make sure we do the budgeting, and in 2 or 3 years we can get it done instead of doing it all at once, like with the budgeting part of it. You know what I mean? Like plan ahead so that when the time comes, we're ready. Like, I don't think we're ready today to make that decision. That's just my opinion.
You're suggesting doing it the old-fashioned way, save the money and then do it. Councillor Jaguar.
Thank you, Mr. Warden. It seems to me, I feel ready to make a decision because it seems to me that option number 5, the expansion, appears to be solving the problem of the public gallery. And I don't know if that's what Councillor McPhail was referring to. Is that the problem that we're trying to address? And that's the only clear point that I see. And if that's the case, I'm actually not sure that that's necessary. This is now 2021. Our meetings have never been truly accessible, being on a Tuesday morning between, during business hours, and expanding a public gallery to the tune of, $1 million+ is not a need, in my opinion. I think the more we make it accessible through electronic means, so as long as the sound is really good, if you are in the gallery, as long as there are proper screens where you can see everybody, a remodeling is more than enough. I think it is needed. The remodeling is needed, but the expansion, I can't see in the future being needed at all.
Further comments?
Mr. Warden?
Go ahead.
Yeah, I would agree with Councillor Jiguer. I think with now that we're live streaming and that people can access it far easier, I realize delegations, it will be a little trickier because it would be nice to have them in person, but I would agree that only remodeling, I cannot justify spending that amount in these times. I can't imagine the public being happy with spending that amount either.
Thank you for that comment. Councillor McPhail.
One of the things that does jump out at me that in these designs that's come forward from the consultant, there are placeholders for the people to actually sit in council at their meetings. And I'm thinking one thing that COVID has shown is that that's not a necessity anymore, because as I look on the screen here, many of our staff people are sitting very comfortable in their office, being able to participate with the meeting. So do we need to put space in there for them, or are they very efficiently working out of their own space? And you know, if that does free up some of the room in there for additional if there are people that wish to come to our meeting. I think Bob and I go back to the day when there was 26 of us in there, plus the staff people. And, you know, it worked fairly well. You know, we seem to be able to deliberate and make decisions and move on. And then when the restructuring come in, well, we downsized to the 9 people. So I'm thinking that I agree with the fact that, yes, because of the mirrors on the wall that had to be removed to be able to work with the live streaming, certainly I think it's probably in time that the room was freshened up and possibly some new carpet put down. But I think that the changes could be very, very moderate. Not a whole lot of money, and probably the building will service the county council and Central Elgin and the other people that use it for many years into the future.
Well, for my 2 cents, I certainly agree with that. You know, no matter what we do, there's not a huge capacity. If we have a real barn burner of a people throng here, we may, and that happens once in a while, and maybe need to go rent an arena or the Masonic Hall or something for those special, extraordinary term times. But again, when I look at we prioritize connectivity, we need money. Certainly, we have a lot of people suffering through this pandemic, and we're not done yet. So that's Councillor French has pointed out, we don't know where we're going to be in a year. So I guess at this point, if there's no one else wants to speak to this, we're probably at the point where we need to make a decision.
Mr. Warden, I simply have a question for Brian. Having heard everything that basically we don't have to accommodate county council members or staff with huge changes in that, Brian, of all the options that you have, which one complements all the other work we're doing in the building the best? Should we just be going with number 6 and leaving the council chambers alone, or should we just do some, as Doug pointed out, do some minor upgrades, and which option would be the best one in your mind to complement the other work, taking the full blow and work right off the table?
Through Mr. Warren to Councillor Purcell, I would say options 1 through 4 generally consist of lighting upgrades, some potential furnishing realignment, flooring replacement, improvement to sound, audio, that type of thing. Again, staff will undertake further reviews with respect to mainly the seating arrangements and seek some further input from council at a future meeting. From a timing perspective, it's envisioned that this work would likely be phased in with part of the elevator project. and would be completed hopefully later this summer. If not, it may be deferred till next summer. Again, subject to receipt of a contractor's schedule and examining that schedule with respect to impacts to our tenants and the various meetings that occur in that space as well.
So if we told you to go ahead with option 4, that's the most expensive of the minimal options, but it would cover all the bases that would work well. So I'm happy with option 4.
Are you prepared to make that a motion, Bob?
Yes, I'm happy to do that.
Do we have a seconder?
Just interject.
Go ahead.
Is there an option 6 for main lobby and reception area renovation at the same time as the council renovation? Just to double up on the motion.
Yeah, I have no problem with that. That makes abundant sense.
Yeah, if you're gonna have the mess, get it done. Did we get a seconder for that or more discussion?
Question, Mr. Warden. So by choosing option 4, would we be choosing the seating arrangement as well? Because I wonder if we could have discussion on that, whether that's the best seating arrangement for council.
Through Mr. Warden, through to Councillor Giguère, yeah, once again, we'd be happy to have further discussion about a final seating arrangement once a further design is completed.
Okay, so I would be happy to second that if we're not including the actual seating arrangement. I will second the motion.
Further discussion before I call the vote?
Just clarification, that's 4 and 6. Bye.
Okay. Is everyone clear on the motion? All right, call the vote.
Deputy Warden Mennel.
Yes.
Councillor Purcell.
Yes.
Councillor McPhail.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchba.
Yeah. Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
All right, next up is our budget presentation from Jim. Hopefully that made you smile a bit.
Thank you, Mr. Warden.
Go ahead.
Carolyn, if you can put the presentation up on the screen, please. There we go. Thank you. To begin with, just like to say that the Budget Committee went through a very thorough and detailed review over the last number of months in preparation for this meeting today. Just to take you through the highlights of that process, we started back in October. At that meeting with the Budget Committee, we did an overview where each department manager took the committee through their departments and plans they had for the coming years. We followed that up with a meeting, our second meeting on November the 9th. In that, we provided line item details with historical data all the way back to 2019 for review by the committee as part of their package, and went through again further detail with the various managers. Questions arose from that meeting, and we followed up with that in our third meeting on November the 23rd, where we answered those specific questions that the committee proposed. On December the 10th, we came back for meeting number 4. In that, we focused on looking at the tax implications of the various changes that were being proposed. At that meeting, the committee provided direction on a preliminary recommendation to council. We presented that to County Council on January the 12th, and then followed up with our 5th Budget Committee meeting just on feedback from the council meeting. Finally, we had our 6th meeting on January the 26th. And in that meeting, the committee then reviewed a final recommendation to be presented today at County Council on tax rates and final budget numbers. Next slide, please. Just to go back through a little bit of history, 2020, a year ago, we went through a 10-year plan running from 2020 through 2029. And the goal last year was to have measured tax increases over the 10-year window to avoid double-digit tax increases and to use reserves and debt to gradually achieve that objective. The reason that there was that type of pressure and need for consideration was because the asset management plan was presented, which was adding $50 million in spending. The first thing that council did in order to reduce taxes was to look at what funding could be achieved externally through both provincial and federal infrastructure funding. After all that was exhausted, a reasonable tax increase over the 10-year window of 3.6% was approved by County Council. Next slide, please. Next, to take you through some of the highlights for this year's budget and 10-year plan. One, we'll start with efficiencies. 200,000 has been achieved in efficiencies predominantly through the homes. And they've focused in on case mix index, which is provincial funding driven by a recording that we do on the severity of the cases that we have in our homes in terms of work effort. And we were able to achieve each year an additional $200,000, which is flowing through as revenue and reducing cost pressures as a result. On the other side, with costs going up, we had a continuation of the asset management plan, this time with focus in on facilities as opposed to linear assets. And the outcome of that was adding approximately $900,000 annually to the budget. Insurance, not unlike across the province and the country, there's pressures on insurance. We see those going up, and there's about $100,000 being added to the budget for that purpose. Next slide, please. Next, going on to service enhancements that have been included in this budget. Economic development has gone through and reduced their programming significantly, and that money has been redirected through the direction of the committee. They're recommending that that be put into a reserve to be decided upon on a later date to further fund the community improvement plan. So that's $150,000 annually that's been set aside for future consideration by council. In the outlying years in the plan, we're looking at a library expansion, and about $60,000 is included for that purpose. And as a result of the service delivery review that was undertaken last year in great detail, the committee is taking the recommendations from that service delivery review and has added $300,000 annually to the budget for that purpose. Continuing on to the next slide, please. With this pie chart, we're taking a look at how our money is being spent, excuse me. And in 2021, the budget before you today has costs of just over $72 million. The homes make up 35% of that cost, transportation 19%, and ambulance 16%, those being the major items of where our budget is being spent. Next slide, please. Next, looking at capital. In 2021, the capital budget includes costs of almost $30 million. In this case, where the money is being spent is predominantly transportation services. As you can see, they make up about 3/4 of our capital budget. In addition to the money that council, if approving today, is adding to the budget, there is also carry forward from previous council budgets. And we are carrying forward about $40 million of projects that are yet to be completed. That is predominantly explained by the Terrace Lodge redevelopment project. Also worth noting, as I mentioned earlier, we had the $900,000 being added for capital maintenance on buildings, and that then adds about $9 million to the plan over the 10 years. And next slide, please. Of that $30 million, as well as the carry forward money that we discussed, some of the major projects are listed here. I'll just hit a couple of them as examples. The Terrace Lodge rebuild, we have almost $33 million yet to spend. The King George Lift Bridge is well underway, but still $4 million set aside for the completion of that project, and Rodney reconstruction at $5 million. Next slide, please. As I said, the committee is using debt as a way to keep tax rates affordable over the term of the plan. You see here with the gray bar chart, the plan for debentures in each of the coming years. In November, we had our first debenture of $6 million. This year, we would then take on a further $6 million of debentures. By 2025, we will have acquired a total of $44 million of debentures. You can see with the orange line how, as we take on those debentures, our total debt climbs, but at the same time, we're also starting to pay off the debentures that happened in the earlier years. So we hit a peak of $30 million of debt in 2030. By 2025, of $30 million of debt. By 2030, we're down to approximately $8 million of debt because of the repayments we're doing, because these terms are based on 10-year repayment terms. Continuing to the next slide, please. On this chart here, you see the same orange line that we saw on the previous chart. Laid up against it is a blue line, which shows the cash investments we have on hand. In past years, council has set aside money to pay for partially to pay for the investments that we're making in the future. Predominantly Terrace Lodge being a big one. County Council set aside money for that project. So as you can see, we have over $30 million of cash and investments available to help fund this capital program that we have before us. We draw down on that over the next couple of years as we are very intensive on our roads projects in the next couple of years, as well as obviously the Terrace Lodge being the big one. That draws down on our cash, and then you can see by the outlying years, we have about $15 million of cash, just under about 14, and that represents 1/4 levy payment, which we consider to be a minimum that we want to have on hand in order to manage our cash flows between one levy payment and the next. We had a discussion in the steering committees. If we can just stay back on that. Okay, great, thank you. We had a discussion in the steering committee about debt terms, and the decision was made by the committee to recommend 10-year terms on these debentures, and then it would be rolling debentures over the coming years. So looking out into about 2031, I know that's a long way away, but you can see as our road projects continue to have expenditures in the outlying years, we're going to be drawing down on cash. Debt is starting to be paid off, and we will probably be required to have about another $8 million of debt in 2031 to keep us at that minimum amount that we would like to have as cash on hand to manage our business. Next slide, please. Despite all of that, we have been able to, the committee's been able to build flexibility into this plan. Obviously, COVID has been a major challenge in 2020, as it continues to be this year. We have, from 2020, about $900,000 of money that will be carried forward from the COVID money, the SRF money we received from the province in 2020. As well, we received incremental money of about $250,000 for this year. In addition to that, through the tight management that council considered last year to offset the implications of COVID, we were able to achieve operating performance, budget performance of $2.6 million. And we had capital surpluses as well of approximately 2.9 million. Those are both estimates at this time, but are close to where we expect it to come out. That provides County Council with about $6.6 million available. And we see between SRF or COVID uses and reserves that are being recommended about $700,000 related to SRF. The service delivery review, as we discussed earlier, is going to be adding about $300,000 annually to the plan, which works out to $3.4 million over the 10 years. As well, at the last council meeting, there was an addition done to the capital budget of $200,000. Even with all of those items, we still have about $2.3 million available to have in reserve for other purposes. Some of those purposes, just as an example, could be if COVID costs are higher than we have set aside in those uses that defined above, which is a possibility given all the unknowns of where COVID is going and what demands the province is going to be putting on us in terms of long-term care and the operation in the COVID environment, as well as broadband could also be a future use for some of that reserve money. Next slide, please. Which now gets us to the discussion around tax increases. A year ago, the Council had approved 3.6% tax increases from 2020 through 2029. So that is the starting point for this year's 10-year plan, was a 3.6% increase in 2021. As we discussed at the council meeting at the beginning of January, we had good news from pills and supplementals, which is reducing taxes by about 0.7% from what we had previously planned. And then on the flip side, the province is going to be downloading costs in future years from the health unit. That adds about 0.2%, and the new ambulance contract adds another 0.2%. Those two increases are offset by the good news we received from the province on the funding for the Terrace Lodge redevelopment, which provides an improvement of 0.4%. The net impact of all of that is a recommendation from the Budget Committee for a tax increase of 2.9% for 2021. Last year, in 2020, the levy was just over $37 million. A 2.9% increase would add another 1.1 million to that amount. As well, as we mentioned earlier on this slide, we had good news on growth, and that growth is adding another $700,000 in levy for 2021. The net result is a levy of just under $39.1 million. Next slide, please. So to summarize, the tax rate increase being proposed by the committee is 2.9%. If we, as an example, took a home that was valued at $350,000, that would be an increase in county taxes for that house of $61 on the year. The net impact, or the net levy across all the various households and the new assessment that we gained in 2020 will give us a levy of $39.1 million, which is a $1.8 million increase over last year's levy. Continuing on, please. This pie chart shows you then, in addition to the levy, all the various revenues that comprise the county budget. You can see that the levy makes up about half of the county budget. Provincial and federal funding makes up 29%. If you were to go back about 10 years and look at a pie chart, a comparable pie chart, you would see that the provincial and federal funding used to make up half of this pie chart, with the levy making up somewhere in the neighborhood of around 40%. So our levy has gone up and the provincial funding has dropped dramatically. And county councils, past county councils, had no choice but to make levy adjustments to compensate for that dropping provincial revenue. Next slide. Which takes us to the recommendations being proposed by the Budget Committee. And that is that a 2.9% tax increase for 2021 be approved, which equates to a 2021 levy of $39,060,000. And that a further $6 million of debentures be acquired in 2021 as part of a plan to acquire $44 million over the term of 2020 to 2030, and additionally allow up to $50 million in temporary borrowing to meet short-term immediate cash flow needs. That item there is just a standard housekeeping matter that we do every year. Although we do a bylaw each year to allow temporary borrowing, we've done that year after year. We haven't drawn upon it in the past. I don't see us drawing upon it this year, but it's always good to have in place for emergencies. On the next recommendation, that the overall 2021 operating budget net income of $9.4 million be approved, being the result of carry forward operating project net revenue of $2.5 million and then the base budget of $6.9 million. That the 2021 10-year capital plan of $209 million, which includes for 2021 capital spending of just over $70 million, and that's comprised of carry forward budget from prior years of $40 million and the base budget of almost $30 million. And then at the end of this meeting today, there'll be the two bylaws before you for approval. Thank you, Mr. Warden.
There. Now, I would like to point out a lot of work has been done on this budget committee. Deputy Warden Mennel has chaired that for the bulk of the year, and then I was thrust into the job a month or so ago. I'd like to commend Councillors French, Jaguar, and Ketchaboff for their efforts on this. I think it's come a long ways. There's a lot of information, a lot more understanding. Is that fair to say to the councillors who have been on it? But
just to comment, Mr. Ward, certainly we were looking at threefold. We've got a 9, so I think congratulations to Jim and the committee for doing that.
I would have to agree with that wholeheartedly. Further comments? Are we satisfied with this? Go ahead, Councillor Jaguar.
Thank you. Yeah, a couple comments. So yes, I want to recognize the work of staff. I did so during the committee meeting, but wanted to do it also in front of council. I also want to point out, I don't know if we mentioned that we included a public survey this year, which I think was also a first. So we managed to implement additional sources of input and analysis all in 1 year. So our one budget season, as I'll call it. So I think a lot of great work went into it. And I think the committee is quite confident in the recommendations that we're bringing forward. I will mention, though, that in reviewing the detailed line-by-line pages that are included in today's package, back in October when we discussed the process, the committee had requested that the line-by-line budget details include actuals from 2019 and 2020. So to date, we did not receive that. So I will put it out there for council's consideration. It is something we requested. It was, for the record, agreed upon, but we have not reviewed that information. So there's perhaps an option to defer potentially until the committee has a chance to see that, or all of council has a chance to see that.
Go ahead, Jim.
If I may.
Yes.
The November 2nd committee meeting, we had included, the request was made in October, and we included that detail in the November 2nd meeting. That included the 2019 actuals, the 2020 forecasted actuals, as well as then the budget for 2021 through 2030. And that was included in that deck, which was published publicly from that November 2nd meeting.
Councillor Jiguer?
Yeah, so just to clarify, through you, Mr. Warden, to Jim, are you referring to the departmental presentations that had the detailed charts? Or was there, am I missing an additional document, like the line by line?
That agenda package had the line by line in it, as in addition to the presentations each of the departments did. The package that was sent out included line by line detail.
Okay.
Councillor Ketchba.
Thank you, Mr. Warden. I would mention that, yes, we did see departmental budgets and we did see the I guess you could say the actuals or the forecasted actuals for 2020 at that committee level. However, I would argue that the departmental breakdown was not as detailed as what we've seen in this particular budget presentation. And I would simply put it out there for council consideration that the starting point for the 2022 budget season would include the actuals or 2-year actual for based on those detailed departmental budgets. I think it's important from a clarity point of view, from a transparency point of view, and helps us build moving forward.
All right. Councillor McPhail, where'd you go? I saw your hand up. Go ahead.
Yes, thank you, Mr. Warden. Certainly, I know the committee has worked really, really hard on this. A little difficult as it is the first year in a 10-year roadmap of county council, or of Elgin County in where we are now and where we're going to go. Again, I brought this to county's attention before, but the term broadband was only referenced once in the report that our treasurer brought forward to us, and that reference was that out of the $2.3 million that we have in hand because of some favorable things that happened to us last year, the reference goes that broadband, this money could be used for, and that means that it's in competition with just about anything and everything else that might possibly come our way from the potential of a bridge falling down or you know, COVID goes off the rails somewhere. So certainly there's no guarantee that it's in there, and if that's the direction that we're going to move, something as important as broadband is going to be funded on maybe what happens favorably to us every year. I'm not so sure whether that's the greatest plan, but it is what it is, and I've certainly had my opportunity to voice my opinion, and that's what it is my opinion. So let's move on.
Question I had, Jim, if we had have decided to really go in full tilt to renovate this council chambers, that would have been some of the unallocated money we would have tapped into?
It would either be coming out of that, or as council then could also, as was done today, or could have deferred rather to future tax rates, and it could have been an implication then on the 2022 tax rate increase.
Further comments?
I'd like to make a comment, please, Mr. Warden.
Certainly.
One in response to Councillor McPhail's what he's talking about with the connectivity committee. It's really difficult for the budget committee to put aside money when we don't have numbers. We still don't have any specific numbers, so we're just guessing what would be the best approach for that. And a point was just made again, and I made that clear before, with this potential expansion of the council chambers. We weren't privy of that at the time when we were doing our budget deliberations. So the thing is, when we don't have the information, we can't put it in the budget, or we can't figure out a way of approaching that. So I just want the rest of council to understand that unless we have specific numbers with specific information, it's hard for us as a committee to come back to council with clear and concise information and direction of what we think should happen.
Thank you for that. Point taken. Further comments?
Mr. Warden?
Go ahead, Bob.
Yeah, it's Bob Purcell. From the conversation, it appears that council supports the tax increase in the budget, but there obviously this tool to move forward for, especially for the 2022 budget, is necessary and had been promised in great detail, as Ketchabah and Dominique pointed out. We should be able to provide the actuals for 2019, the actuals for 2020, and then the 2021 budget as the starting point for next year's work, and that should happen every year in the detail with the 3-year comparisons. I suspect that's quite possible, and we could go ahead and approve the budget today, but with the promise that'll be prepared as quickly as possible and shared. The committee's not going to change. We've already set the committee for next year. So if the committee's happy with that, I'm happy to move that we proceed with the report and the budget as it is, but on that condition.
Does that satisfy the members?
Yep.
With that understanding? I'm seeing heads nod, so Councillor Ketchabah?
Yes, I think that would be suffice. And I'm not trying to put staff on the spot here. I just simply want to put clarity out there that these are some of the tools that the committee would require moving forward. Each year, the budget process has been getting better, and there's more clarity being provided. But this is just the next step, and this is something that we've asked for, something that we require. But I want to have some clarity here on one thing. I just want to confirm with Jim that in the departmental budgets that we have presented today in this package, the 2020 numbers are budget numbers. They are not actuals. Is that correct?
Correct.
Okay.
And the 2020 actuals we are still finalizing those for this year.
Yep.
So anything we would give you would be a forecast at this point until we complete the full year.
I understand that, and I would expect that it would be towards the beginning of the next cycle or somewhere in the near future when those become available. We'd start going. But
yes,
I have no expectation that they're available yet. They're not available in Bayham, and I can't expect them to be available at Elgin right yet.
Yeah, no issue with that.
All right, we have a motion by Councillor Purcell with a request for additional information. I believe I'm getting a seconder from Ketchabah. Are we ready to vote? No further comments, discussion? Seeing none, go ahead and call the vote, please.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Oh,
Is that a no?
that's a no.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Jiguer.
Yes.
Councillor Ketchabah.
Yes.
Mr. Warden.
Yes.
8-1, the motion is carried.
Thank you for that. And again, a big thanks to the members who served on the committee. Lots of hard work. Appreciate it. What's up next? County Solicitor, interim transfer agreements. POA.
Mr. Huber and I appear before you today with respect to or to inform you as to the recent developments for the transfer of Part 3 and Part 9 prosecutions from under the Provincial Offences Act. You have actually, there's 2 reports. The first in open session, which doesn't reflect the specific or details of the proposed interim transfer agreement, and the second report in closed session does include that provision. In any event, when we were last before you on this matter was in August of 2020. At that point, the province of Ontario, through the Ministry of the Attorney General, was seeking approval of amendments to the original transfer agreement from 2001. Council approved those revisions and proposed amendments,
that would affect the transfer. Our position was communicated to the province. That transfer was delayed due to opposition from other municipalities that would incur expenses that Elgin will not occur through the transfer and the planning that we've already undertaken. The province attempted to deal with the opposing municipalities. That process is still ongoing. So the province is now suggesting an interim transfer arrangement for a period of 2 years, although that's renewable, under which the transfer of prosecution responsibilities are given to municipalities that are ready, willing, and able to perform those services. We have certainly indicated that we are in this latter category of preferring to proceed with the transfer. Mr. Huber and I reviewed the transfer agreement. There are primarily, and subject to what we may review in closed session, there are 2 items of concern, one relating to an insurance certificate, the second relating to indemnification. We have proposed revisions to the province through the ministry. We have not yet received a response. The recommendations before you in open session are to approve the interim transfer agreement, subject to the approval of the county solicitor as the final terms and conditions. That relates to those 2 items. And if there is satisfaction as the final terms, that approval for execution or authorization for execution also be delivered. If you're satisfied with that approach, we can deal with the report and the approval. If you require more detail as to the specific terms and conditions of the interim transfer agreement and the concern that Mr. Huber and I have, we will have to do that in closed session, and then we can return to the recommendations in open session following the closed session.
What is your will and pleasure? Councillor Jones?
I guess we should probably hear the concerns from their solicitors.
Right. My recommendation would be then that we defer to following the closed session. And I can provide the details with you with that during the closed session.
Do we have a consensus from everyone? Seeing heads nodding. Okay, so we'll defer that.
We need a motion to defer.
Oh, yes, I need a motion to defer. Jones, Ketchbaugh, call the vote, please.
Deputy Warden Mennel,
Yes.
Councillor McPhail. One more time, Councillor McPhail.
Yes.
Thank you. Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Jiguer.
Yes.
Councillor Ketchbaugh.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Thank you for that. Next is council and warden policy revisions. I think it's fairly straightforward. Any questions?
Just one
If not-
comment, Mr. Warden.
Go ahead.
We probably should, under the ties and such, mention ascots, just because we are doing that now with the female members and staff. So I just thought that probably should just be added to that section.
All right, with that amendment, small amendment, I guess I'd look for mover and seconder.
So moved.
Deputy Warden Mennel. Councillor Jiguer, please call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden.
Yes,
9-0, the motion is carried.
thank you. School retention. Is that you, Julie, please?
Thanks, Mr. Warden. Through you to members of council. At your most recent meeting on January 26th, council directed staff to provide a follow-up report with respect to correspondence received from Zora and their efforts to come up with a school retention plan. So assuming you've read the report, council at this point, or staff at this point, we're seeking direction with respect to council's desire to have staff establish a school retention plan. It is important to note that this is outside of the priorities identified by council as part of your 2020 to 2022 strategic plan. Would be happy to proceed as directed.
If I was to ask who would end up doing this work, who would be doing the work?
It would be the administrative services team.
Mr. Warden, I'd like to speak.
Go ahead.
Yes, I think it's left out probably I probably neglected to put it in. I think it should have been in our strategic plan. It is something council has been working on for several years now. We fought very hard to save Springfield and New Sarum and were successful, and to get a school in Belmont. We have a rural education task force who are working on this. And I think it's very important that all 3 counties that are involved, considering Oxford have already done this, I think, and I know Middlesex are working toward it as well. I think it's important that we all say it's important that rural schools be retained, and that if we have a policy, because we need not to be ignored. County input has been, and local municipal input has virtually been ignored in the past. And so I think it's important that we put this together, and it can be based very much on what Oxford County have already done and what Middlesex are doing right now. I don't see it as a lot of work. I just think it's very important, and I would certainly, if I'd been on the ball, I would have had it in our strategic plan.
I cannot disagree with anything that has been said. I'm just looking at the workload on staff, and are they going to do this between 10 and 11 at night? I think we're so stretched, but I'm only one person, so I'm opening the floor to comments here.
Just one further comment, Mr. Ward.
Yes?
If we don't do it, we can't blame the school board when they close some of our schools, because we have advocated strongly enough for this. Really hard at that. Deputy Warden Mennel will know he appeared before the board several times, as did I, and I know that Councillor Jones did as well. And I think it's really important that we let the board know that keeping our rural schools, such as the West Elgin Secondary School, those are really important to our communities.
Thank you. Further comments?
Just a question to Julie, Mr. Warden. Obviously, Middlesex and Oxford have already got a template. Can we not simply adopt their template and just revise it to suit Elgin?
Go ahead.
Thanks, Mr. Warden. Through you to Deputy Warden Mennel. I wasn't able to find that Oxford County has a plan. So Zora has a plan. We could certainly use some of the information that is included in Zora's. I also wasn't able to find that Middlesex has a plan. But as Councillor Martin mentioned, a lot of work has been done by council, by local councils in this area. So we could just pull it all together and it would form a school retention plan. But as far as Oxford and Middlesex, I don't know, Councillor Martin, would you have copies of those school retention plans? They might be of help to our team.
Yeah, the Middlesex one is being developed at this time. I can certainly check and see if I can get of both.
Thank you.
Is this like when Deputy Warden Mennel and Councillor Martin and Jones spoke? Were they speaking on as mayors or county councillors? Is this an upper tier or lower tier or combination? And if we adopt this, do we have to change our strat plan to include it?
Councillor Jones has a comment.
Councillor Jones?
I believe, memory serves me, we were basically speaking on behalf of the county and as a municipal, as a mayor as well, if memory serves me properly.
Hello? Hello?
Just one other thing, Mr. Ward.
Go ahead.
County Council did send letters. They did support it. They did, we spoke. Mr. Councillor Jones was the warden at the time when he spoke, and he was speaking on behalf of both. We have met, as you know, every year with the school board and the county. It just concerns me very much that if we don't do this, they're going to think we're not serious about it.
All right, I'm only chairing the meeting, so I'm not looking for input from the rest of council here. Councillor Jones.
I guess I agree. It needs to be addressed. I guess what's going to get put on the back burner to, from Julie's perspective, to make this happen. As like you are right, there's a lot of stuff going on right now.
I can only go ahead.
Through you, Mr. Warden, to Councillor Jones. That's a good point, and I think it would be important if council did direct this work to also identify whether it is an urgent priority or whether it's something that, say, could wait until end of second quarter, which would afford staff the flexibility to kind of plug away at this over the next little while.
No, I will. Go ahead, Councillor McPhail.
You know, we talk quite often about being very cautious in the amount of work that we ask our staff to produce for us. You know, we have wonderful administrative staff that if we say no to it, this council would put before them. But I think it behooves each and every one of us to really understand the fact that we just can't keep piling it on and piling it on. Even how great an intention that it is, there comes a point in time that we have to recognize as councillors that, you know, when it might not be much work. Well, certainly it's not going to be any work for any of us sitting around the table here, but it could be a lot of work that we rely on to keep things going. So I can't support putting another file on Julie's desk, even you know, certainly at this time, maybe something a little later, but I know Julie won't say no, but it's time that some of us started saying no for her.
I will say I'm looking at former Warden Jones, former Warden McPhail, and former Warden Mennel, and myself sitting in this chair. We get a real close-up look at the workload on our CAO. And I wasn't joking when I said, like, when will this, I know the hours she's put in the last couple, 3 weekends. And when you're on a weekend, you're working 15, 16 hours, something's wrong. And that's why I'm hesitating. I'm not saying the school issue, absolutely. It's very important. It's very important. But where do we stop here? I think Councillor Jaguar was first.
Sure. Thank you, Mr. Warden. Yeah, I would not agree with sort of going back to a strategic plan and almost like retrofitting an idea. I think elements of school retention are there in terms of quality of life and what it takes to, you know, keep a community, you know, happy and prosperous. And I feel that when I look at the resolution from Zora, and you look at all of the items they have in the resolution, and as staff described in the report, we're already doing a lot of those things. So I feel very confident that we are being good advocates. We are doing great work. So it may not be consolidated in one document at the moment, but I believe we're doing all of our due diligence in terms of advocacy. We are being heard. We've had success. So I think we're doing very well, and I don't think we need to add more at this point.
Who was next? Purcell, go ahead.
Mr. Warden, this is as much a question as anything. Could we not defer this till Sally provides copies of the Oxford and the Middlesex policies? And then at that time, she could provide those to Julie and her team, and they could give us some idea, a quick assessment on time and work effort that might be required at that time. That way it's not neglected, but Sally has already volunteered to take those on. It sounds like there may be a built-in delay waiting for both of those to get finalized anyway. So let them do all the extra work for us. Their situation is very similar to ours. So it would give us two templates to look at it sometime in the future, but it doesn't ignore the situation.
I like that suggestion. Councillor Jones has a comment.
Actually, I was going to suggest the same thing as Councillor Stell did. And yeah, as Julie's first warden, and things hit the fan fairly quickly after Julie took the seat, and I said it was going to get better. I don't think it has so far, but
All right, do we have a consensus with Bob's suggestion? Have some heads nod?
Mr. Warden, it's very important that Sally be able to comment because I volunteered her to do the work of getting the two draft documents.
I am happy to do that, and I'm happy to have this considered in the second quarter as Julie suggested.
All right, appreciate that, Councillor Martin. So we'll have a motion to defer.
A motion that staff provide a follow-up report following review of Middlesex County and Oxford County school retention plans. So we would provide that follow-up report in second quarter, assuming those school retention plans are available to us at that point.
Mover and seconder, please. Purcell, Mennel, please call the vote.
Deputy Warden Mennel. Deputy Warden Mennel. Oh, I think you're muted.
I think you're muted, Dave.
Yes.
Thank you. Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchabah.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Thank you. COVID-19 emergency team planning.
Thanks, Mr. Warden. Through you to members of council, just our monthly update providing how the organizational response to COVID-19. Happy to answer any questions.
Questions for Julie? Mover and seconder, please. Jones. French, call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchabah.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Thank you. Next is Elgin incentives, 2021 funding.
Thanks, Mr. Warden. Just share a couple of quick slides. The purpose of bringing this forward to County Council was just to quickly revisit the Elgin Incentives Program for 2021. Since assuming the role of General Manager of Economic Development Department right now, I have received calls from a number of businesses and a number of residents in our communities, at least 21, requesting additional information about the Elgin Incentives Program. So while Council had opted to defer any decisions related to a 2021 Elgin Incentives Program, I thought it was important for Council to understand the number of calls that we're receiving, the community discussions that are taking place about the importance of this program, and just revisit it at this point to see whether there is interest, renewed interest from County Council to continue with the status quo program, continue to defer this matter until after a decision is made with respect to a joint economic development corporation with the City of St. Thomas, or otherwise. But worth quickly checking in with Council to see if there was a change in perspective. Happy to answer any questions.
Comments, please.
Mr. Warden?
Go ahead.
Yeah, I think if we're doing a joint one, if we end up with a joint one, it isn't going to happen in 2021 that I see, because we're already into the year. I would like to see the Elgin Incentives Program continued for one more year until we get what's going to happen.
Thank you for that. And further comments?
Mr. Warden, I would agree with Sally. I think that the potential aligning with the City of St. Thomas may take some time. This Elgin Incentives has been very successful, and I know there's some pending people that have got applications in. So I would agree that we carry on under Elgin County's supplement to this for the time being, and hopefully when when there's potential amalgamation with the City of St. Thomas, we can carry on.
Further comments? I can attest that I have been lobbied as well, so.
Mr.
I'm
Warden,
sorry. Go ahead.
yeah, I can concur that we should continue on. I know that's Southwold Township's position, so I would support that.
I suspect we probably would have liked to have been further along in this, but again, it comes back to the workload. And so I agree that the recommendation probably for this year to carry on status quo.
I would make that.
Mover. Okay. We have a mover, Martin and Mennel.
If I may just clarify, so it would be that staff proceed with the status quo Elgin Incentives Program for 2021. Also that staff be directed to continue to work with our local municipal partners to conduct an ongoing review of the Elgin Incentives Program to ensure program alignment with community need, and further that staff be directed to present alternatives to council as part of the 2022 budget review process.
Yeah, I'm good with that.
Yeah, heads are nodding, so I think we're ready to call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
All right, thank you. Reports of council, outside boards and staff?
Correspondence.
Correspondence. Okay, items for consideration, we have two. Any action on them, or if everyone read them? What's your will and pleasure?
Mr. Warden, just on number 2, certainly Malahide supported this, but with the caveat that we need more information, because the province has stated they want to close this down, but they haven't stated how going to replace that training and who's going to pay for it. So certainly that is very important. So I supported it with that caveat, and I suggest the county does the same thing.
You making that a motion?
Yes.
Is that second by Jones or comment?
Yeah, Southwold dealt this last night as well, and we support the motion at Southwold, so I'll support it now for the county.
Okay. Ready to vote on it? Please call the vote.
Thank you. Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguere.
Yes.
Councillor Ketchba.
No.
Mr. Warden.
Yes.
8-1, the motion is carried.
No, thank you. Now, the first item, are we just going to receive and file? Motion to receive and file the first one?
Yeah, so moved.
Mennel and Giguere, call the vote, please.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguere.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Thank you. Correspondence items for information, newsletter from the Western Ontario Ward Caucus for your information. And we'll, if you haven't heard, Warden George Cannell was elected chair. We met last Friday, so I like George. Do we need receive and file? Motion to receive and file. Jones and McPhail, all in favor, or call the vote, please.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguere.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Are we at other business?
Yes.
Statements, inquiries by members. Seeing none, notice of motion from anyone. Seeing none, matters of urgency. Go ahead.
With your consent, Mr. Warden, I would ask that council consider 2 additional items under matters of urgency, the first of which is Dutton-Dunwich settlement areas. And the second would be an Elgin-Oxford joint application to the Municipal Modernization Fund for an EMS master plan.
You have my consent.
Let me get a vote.
Amy?
Vote.
Oh, vote, sorry. I'm getting distracted, sorry. Mover and seconder for that, please.
So moved.
Mennel and Jones, call the vote, please.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguere.
Yes.
Councillor Ketchba.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Okay, Dunwich settlement area.
Nancy.
Nancy? Go ahead, Nancy.
Thank you, Mr. Warden, through you to members of council. So I was asked to bring a brief overview of settlement boundary expansions to the county council from a request by Councillor Purcell. There are 2 ways that a municipality can consider settlement expansions at this time. One is a comprehensive review at the time of an official plan, an official plan review, much like we're undertaking right now, which would require the appropriate background studies. Or the second way would be there could be a swap of lands so long as there is no net increase in land. Our current official plan hasn't been reviewed since 2013, so we have no alternative numbers at this time that would support a settlement expansion. So in order to consider a settlement expansion for Dutton-Dunwich specifically, there would need to be an expedited population projection done for just Dutton-Dunwich But obviously there would be repercussions for costs, the actual project itself, and the impact potentially in other municipalities. Otherwise, there is no other way at this time to be able to justify a settlement expansion. So I'm available for any questions.
Questions for Nancy?
Hey, Mr. Warden,
go ahead.
When you're ready, I want to explain why we're here and why Nancy agreed to bring this forward for us.
Go ahead.
Hey, this is good. Something that's going to obviously be an important discussion as we do the county official plan. As you're all aware, we just finished our official plan. We're running a little ahead of everybody else. And this is one of the things that has arisen. Although I'm going to be speaking on behalf of Dunwich, this is a problem that has arisen for all of us. And I've talked to some of the other mayors, and they have the same problem that we have. Nancy has laid out that she has a job to do, and she is governed by rules, regulations, laws. She can't go changing those or even really interpreting them like we can. So I think one of the things we're trying to do is, as we start down the path for the official plan for the county, is just judge the feelings of county council around flexibility and around the new realities of 2021 and 2020. One of the things that happens with the official plan, her hands are tied to some of the things she pointed out. They're tied to, if you have a settlement area, it can't increase. We all know that there are designated areas within our settlement areas that over the years, either the intended use or the practical use has changed dramatically. Also, they have rules around population counts, which is a huge weighing factor when you're looking at increasing a settlement area. Her hands are pretty much tied unless she gets a good reading from us about how flexible she should be while staying within the rules of the law. And also, more importantly, if she wanted to direct any of us, and I've already asked for this, direct me to people in the ministries that are her bosses so that we can have discussions around this. And this won't get resolved today, but very specifically what I'm talking about with this is if we're going to have our hands tied with these outdated numbers, the numbers have always worked well in the past. They are, if you know the law of large numbers, that they work over time. However, we have a very, very different situation as far as population growth and as far as demands go, brought on for two reasons. We have an unprecedented and permanent migration from urban areas to our locations. That starts in the Toronto area. People are fleeing that. They're capitalizing on ridiculous housing prices. They may not come here, although a lot have come to Dunwich for some reason, but they may go as far as a Brantford or a Paris, and then those people move on to a London, and then a London pushes them out here. We have totally unprecedented demand for homes and for expansion in our area, and I'm sure the rest of you are already beginning to see this. With this migration that is real and permanent and going to be long-term, that blows away reliance on past numbers. I refer to these things kind of like if you're looking at an OPP officer and you're looking at the 401 and you're looking at all those things. We can't be looking in the rearview mirror when we're bombing down the highway. And there might be speed bumps, there might be detours, and there might even be accidents going forward. We need to be able to have some flexibility to understand the realities of today. The other impact that is huge is the digital world. We have all learned that we don't have to be in the county council chamber. We don't have to be in the office. We don't even have to be in Toronto anymore. I'm one of those people that commuted for most of my life because in my case, if you parked at the airport, it didn't matter where you lived. But that's a fact of it. You know, that's the mega center for Ontario, and this is all migrating out our way. So what I think we need is all of us have to understand there's going to have to be some flexibility and not as much reliance upon the past numbers as there is on the demand that we can see, we can prove in the very short term now with people migrating in unprecedented numbers and with the transition to working from home and being able to do those things. The other thing is, in all of our settlement areas, I can show you areas in Dutton Dunwich where they were set aside for residential development or something, but over the years, the lands have changed hands. And for example, we have a large piece in Dutton that is several acres that's designated for residential development. It was purchased by an individual who's built the biggest, nicest home, the most expensive home in West Elgin, and they have no intention of ever having that land developed as long as they're alive on that home. We should have a mechanism where when you get into the swaps, where that could be just turned into future development, even going through the process with them okaying it or understanding that, and use another piece of land where somebody can come in and physically go ahead and invest the money and is willing to do so right now today, and you can prove that. The same thing is happening with speculators. We have mostly the commercial and industrial land in Dutton Dunwich that's tied up by people out of Toronto. It has been for years. They have no intention of ever developing that land. They're just trying to hold it out for a ransom price. Then we should be able to just redesignate that as future development and leave it there. But if we've got people that want to invest in our community, then we should be able to find a way to accommodate them. I'm not saying that we throw out all the rules or anything, but Nancy should be able to have that flexibility and that ability to understand the individual situations in each of our individual communities. The other thing is we have ended up with land that was previously designated in good faith that has become what I call sterilized. We, for example, have a bunch of land along our railway properties that's designated for industrial growth. Railroads have changed hands, they've gone out of business. They aren't there anymore, and part of it's been turned over to a utility. Unfortunately, it's brown land, even though our municipality spent a fortune cleaning up one piece of it. When we went to try and build on it and proceed with it, the ministry folks came down and said, no, because of the adjacent land and the leaching, it doesn't matter how that you spent $250,000 cleaning up this piece of property. You can't do anything on it unless you do the whole railroad property all the way in. There's 3 different owners, and then there's Integris bought one of the railroad properties. So that's something that's totally sterilized, and we should be able to deal with that. Another area, we're right on the 401, and this happens with any of our municipalities in the 401. The MTO has sterilized the entrance to our town. Our commercial and industrial land is on both sides of a county road, Curry Road, coming north-south off the 401. They will not let us have any access till we get down to Pioneer Line. And that means that if you're going to try and put in a trucking operation or a truck stop or anything else like that, you got to come down into the municipality, go off at an intersection. Even though they've allowed this in London, they've allowed it in all kinds of other areas, we have far more room to put in those accesses. But we fought that battle for the last 5 years, even when our member of parliament was Minister of Transport. He couldn't convince them to unsterilize that piece of land. So we should be able to recognize that reality, realize that that's got all kinds of encumbrances on it, and somebody will have to deal with that in the future. If they're going to use it, they're going to have to come down and come in from the south side off a feeder road. But we should be able to expand, giving those types of proper arguments versus sticking to the rules. I kind of look at this as the intent of the law versus the letter of the law. Nancy has no ability to change the letter of the law. She has the rules to work with, and she's been fabulous working with us. As we all know, getting subdivisions through is a lot easier than it ever used to be because it's done quickly and professionally. But the intent of the law versus the letter of the law is really important. Somebody has told the OPP don't go out and charge every single person that is 1 kilometer over the speed limit on the 401. If you do that, then you're going to stop commerce and you don't have enough resources to deal with that. So somebody has said, let's go out and get the real bad guys. Let's deal with them. So we should be able to understand where we can take a piece of land that is not in the settlement area now with the right sort of justification on real use right now with real money that'll go into the ground and benefit us, and swap that or deal it with taking something out and leaving it for future development that's already in the settlement area. So this is going to be something that I think we're all going to have to discuss with Nancy. I think it's going to be huge as we do our official plan. But more importantly, I think we're going to have to escalate above, as Nancy's trying to help me do already, so that there's a real understanding. How do we deal with this real life situation in Dutton Dunwich? And I've lived in Dutton Dunwich for almost 50 years now. This is the first time we've ever had a chance to make hay and really expand and deal with this. We have 2 subdivisions. One is exhausted already. The other one was just approved by county council about a month, 6 weeks ago, and 20% of those lots are sold. And we haven't even started to put the roads or the sewers in yet. That's the kind of demand that's out there, and I'm sure the rest of you are already feeling that. So I just wanted to make sure that this gets tabled, that we all understand the issue, and hopefully we can support Nancy, because I like her common sense approach to things, but she also can do the impossible unless we're finding ways to help her do the impossible. I'm happy to answer any questions.
Thank you, Bob. I certainly agree with a lot you said. Councillor Jones has a quick comment.
Just a comment as well. We in Southwold see the same issues Dutton Dunwich is seeing. We understand the position Nancy is in. When we're looking at Southwold, with the number of developments we just are just starting to roll, that in the next before the next cycle for our official plan amendments, which we're going through right now too, we're going to be in a bit of a bind if construction continues for the next 2 years. We're going to be pretty much out of land. We're already looking at an upgrade to the treatment plant in Tallville. We just received our environmental study for sewers in Shed and Fingal, which was a fairly positive review. And we even have developments that have been proposed that Nancy hasn't even seen yet. And within the next 5 years, if it continues, we're going to be out of land. And we do have industrial land that people are sitting on, and really it's sitting there. But in reality is that probably isn't going to anything happen to it for the foreseeable future until somebody else purchases it, or like Bob says, the stupid price is put on it and they let it go. But, I guess asking Nancy, what do we need to go to the ministry and start to lean on them a bit harder to free up your hands a bit, or because it is a concern?
Through you, Mr. Warden, the ministry also has the same sort of rules, I guess you could say. Like I said, it comes from that provincial policy statement in terms of how settlement expansions happen. I don't know what the province can really do for us at this point. As I kind of alluded to, I think a lot of municipalities are experiencing this type of development pressure, and obviously the market across Ontario has just exploded in terms of housing. So we're not immune to it, I guess you could say. We're all kind of experiencing the same development pressures. Now, talking to the ministry, obviously it never hurts to certainly talk to I believe it's called the regional director, basically for Southwestern Ontario would I think be who we would contact. I just don't know if they have any tools basically that are available to us. Unless there's legislative changes or something that changes the actual framework in the provincial policy statement, that's the legislative requirement. So I'm not really sure what staff of the ministry could do to expedite that. So, but that's my take on it, at least.
Bob, you did mention that probably not going to get an answer today. I'm just wondering if that is something that we should start approaching Mr. York and get his assistance on this.
Yeah, from my perspective, we are going ahead as a municipality to do some of that, and Nancy was going to give me some of these contacts. What we need to do, there may be legislative or regulation changes that allow you to do things like turn something into that's already designated for commercial into holding, because you know it can't be developed for whatever reasons locally, whether the people don't want to or there's a dispute over ownership or you name it. And that can stay like that. You can take another piece that makes sense for all the environmental reasons, et cetera, and turn it into commercial. It's just the swapping needs to be much more flexible. And also, when we're looking at expansion of settlement areas, there can't be so much reliance on looking in the rearview mirror. There has to be a lot more focus on what is really happening and where we're going down the road at a high rate of speed. So those are the two things, and they may require legislative changes, but unless we get out in front of it and start dealing with it, it's not going to get dealt with. And we're all going to miss huge opportunities that are once in a lifetime for our communities. Plus, we're also not serving citizens properly who, as Grant pointed out, what are we going to tell everybody? You can't move anywhere because there's nothing available, full stop. That's part of the reason we've ended up in this ridiculous escalation of pricing, because supply and demand is pendulum has swung way too far the other way.
Now, was it your intention today to update us and inform us? Is that enough, or are you seeking something from us?
I wasn't seeking anything specifically other than I think Nancy and I both would like to know if I'm just a voice in the wilderness or this is generally a real serious concern for all of our municipalities. And if that's the case, then I may be coming back and saying, I've got the door open. This is the people we need to talk in the ministry or through Jeff's office. Maybe we're going to talk to cabinet, who knows? But we'll start that process. But I don't think it's fair to Nancy for me to be the only one berating her, and she handles it really well about wanting to change my settlement area and try and make arguments that don't fly easily in the face of the rules and the way her hands are tied with the regulations. And as she's pointed out, maybe even the ministry folks can't do a heck of a lot. It's going to have to be a political decision. So I'm kind of looking for some support or to find out if I'm way off base or not.
Julie?
Thanks, Mr. Warden. Through you to members of council, since this came up fairly quickly and is presented to you as a matter of urgency, perhaps a logical next step would be for council to receive a report, like a proper report at your next meeting, and be able to review the details in more than just one PowerPoint slide presentation, and give you a chance to do your own research, have discussions locally about what pressures exist, and make a decision at that point.
If that satisfies everyone, I will entertain a motion for that to happen. Moved by Bob, second by Grant. Please call the vote.
Deputy Warden Mennel.
Yes.
Councillor McPhail.
Yes.
Councillor Purcell.
Yes.
Councillor Martin.
Yes.
Councillor Jones.
Yes.
Councillor French.
Yes.
Councillor Giguère.
Yes.
Councillor Ketchabah.
Yes.
Mr. Warden.
Yes.
9-0, the motion is carried.
Thank you. Elgin Oxford joint application. Julie asked for this. It's very timely on the calendar. So go ahead, please.
Thanks, Mr. Warden. Through you to members of council. I had a recent discussion with the CAO of Oxford County with respect to the second round of municipal modernization funding. Council will recall that we were successful in our application in 2019 for funding to support a service delivery review. So the province gave us $125,000 to support that service delivery review. And it would seem that second round of funding has a very clear emphasis on working with neighboring municipalities to find innovative joint projects that can benefit each of you. Council will also recall, just as to provide additional context, that when Council contemplated a service enhancement to Elgin St. Thomas EMS, the consultants hired to complete that assessment recommended that Council undertake a 10-year master plan for emergency medical services. Council delayed any action on a 10-year master plan given that the province had announced some modernization initiatives specifically related to EMS and dispatch. However, in the past year, we haven't seen any action taking place in terms of those modernization initiatives, and the opportunity seems to be a good one, where if we were to partner with Oxford for a joint submission to the ministry for municipal modernization funding, essentially we could hire one consultant to complete two separate studies. And those studies would have one area of overlap, which would be the cross-border services that we provide. Additionally, this would look at our facilities, at our long-range planning, at staffing. So a number of benefits that would really help the budget committee and staff as we prepare for the future of Elgin St. Thomas EMS. It is critical to mention that submitting an application with Oxford County does not mean that we in any way have any intention of entering into a shared service for EMS services with the County of Oxford. And the application itself does not mean that County Council has approved proceeding with the actual master plan development or hiring of a consultant. It just means that at this point, we're seeking council support to apply. So with that, I'd be happy to answer any questions that you might have. There is a bit of a time crunch here because a letter of intent is due to the province mid-March. And whenever we're working outside of our municipality, it does take a little bit more time and extra coordination, let's say. So seeking council support for a joint application, and we'd be happy to answer any questions.
Questions for Julie?
Mr. Warden, certainly I encourage that to move forward with this, and I would move that recommendation by Julie.
Thank you for that. Do we have a seconder? McPhail or question? You're muted.
I will second it, but just one question for Julie. As we work with Oxford, which I have no problem working with Oxford, in that terms of reference that ultimately are going to have to be set out for a consultant to look at a master plan, will there be concessions put into that the Oxford-Elgin study also includes the cross border with Chatham-Kent and with Middlesex?
It certainly could.
Do you feel there's a necessity to look at the cross border between Chatham-Kent? I know that I could quite often see one of our Elgin County ambulance is sitting in Middlesex County or sitting over in Chatham-Kent, so there's certainly a shared service that goes on between the two municipalities.
For sure. I think that those pressures exist with any municipality with which we have contiguous borders with. So I think you've raised a valid point, and we could certainly integrate that into the Elgin specific master plan portion.
I think this was initiated by Oxford, so we had probably, we could consider the others.
Mm-hmm.
Would you like to second that with that amendment? That addition?
I'm certainly fine with seconding that consideration, or at least put the thought in the back of somebody's mind that we do have other relationships than just Oxford.
Further discussion? You're ready to vote on it? think ready to call the vote.
Deputy Warden Mennel,
Yes.
Counselor McPhail,
Yes.
Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you. Ready for closed session?
Yes.
Looking at the clock, do you want to take 5 quick minutes?
Done.
Well,
I saw Mary nod her head.
I saw some people.
Oh, okay.
5 quick minutes. We're recessed. All right, I'd like to call the meeting back to order, please. We're at the point, I need a mover and seconder to go into closed session, please. French and Ketchabah, thank you. Please call the vote.
Deputy Warden Mennel,
Yes.
Counselor McPhail,
Yes.
Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you. We are in closed session.
Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden,
Yes.
9-0, the motion is carried.
All right, we're back into open session. Where are we at? Reports on council, or are we done that?
Rise and report from close.
Rise and report. A motion, please.
So for the first agenda item for closed session, which was Elgin, Ontario Interim Transfer Agreement, Parts 3 and 9 Provincial Offences Act. Be it resolved that the report from the county solicitor dated February 1st, 2021 be received and filed. And that subject to the approval of the county solicitor as to final terms and conditions thereof, council consider and approve proposed Part 3 and 9 of the Provincial Offences Act, Ontario Interim Transfer Agreement. And that subject to the direction of the county solicitor, council in open session authorize warden and chief administrative officer to execute a final version of the proposed Parts 3 and 9 of the Provincial Offences Act, Ontario Interim Transfer Agreement as approved by the county solicitor in accordance with recommendation 2 above.
Questions? Moved by Ketchba and Purcell. Call the vote, please.
Deputy Warden Mennel,
Yes.
Counselor McPhail,
Yes.
Counselor Purcell,
Yes.
Counselor Martin, Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you. Next,
For closed session item number 2, which is the crane conservation area, be it resolved that staff proceed as directed.
So moved.
Mennel, Jones, call the vote.
Deputy Warden Mennel,
Yes.
Counselor McPhail,
Yes.
Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you.
For closed session item number 3, organizational review, that the report from the CAO be received.
Okay, Jiguer, French, vote, please.
Deputy Warden Mennel,
Yes.
Counselor McPhail,
That's close to a yes.
I don't know what's going
oh, we can hear you.
on. All right. Good thing I didn't say what I was really thinking. Yes.
Thank you. Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Counselor Marks, or Warden Marks,
Yes,
9-0, the motion is carried.
so that's everything for closed session. Motion to come out, please.
Motion to adopt recommendation.
Oh, sorry. Motion, okay. Looking for a motion to adopt reports. McPhail, Mennel. Vote,
Deputy Warden Mennel,
Yes.
Counselor McPhail,
Yes.
Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones, Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden,
yes,
9-0, the motion is carried.
thank you. Next.
Consideration bylaws.
Oh, consideration of the bylaws, yes.
Be it a first, second, and third read of bylaw 21-03, being a bylaw to provide for the adoption of the 2021 budget of the Corporation of the County of Elgin and to establish the 2021 tax ratios and to establish the 2021 tax rates for the county constituent municipalities.
Mover and seconder, please. McPhail, Ketchabah, vote, please.
Deputy Warden Mennel,
Yes.
Counselor McPhail,
Yes.
Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried. Be it a first, second, and third read of bylaw 21-04, being a bylaw to authorize the warden and treasurer to borrow up to the sum of $15 million.
moved by Purcell, second by French. Vote, please.
Deputy Warden Mennel,
Yes.
Counselor McPhail,
Yes.
Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchabah,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried. Be it a first, second, and third read of bylaw 21-05, being a bylaw to confirm proceedings of the Municipal Council of the Corporation of the County of Elgin at the February 9th, 2021 meeting.
moved by Jones, Mennel. Vote, please.
Deputy Warden Mennel,
Yes.
Counselor McPhail,
Yes.
Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchba,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried. Chairman.
okay. Now, I hope this isn't the longest meeting on record. I wouldn't want to go down with that record, but I do want to thank everyone for your attendance and your support. So I think we're at the point of looking for a motion to adjourn. French, Jones, call the vote, please.
Deputy Warden Mennel,
Yes.
Counselor McPhail, yes,
Yeah.
thank you. Counselor Purcell,
Yes.
Counselor Martin,
Yes.
Counselor Jones,
Yes.
Counselor French,
Yes.
Counselor Jiguer,
Yes.
Counselor Ketchabah,
Yes.
Mr. Warden,
Yes,
9-0, the motion is carried.
thank you. We are adjourned.